Tina?
Yes.
Okay. Priyanka, you be seated. You have registered candidate over here. Back to you. She is my PhD scholar. She is registered also, but she has done her PhD.
Before we begin, I hope you all have a nice time with the tea and breakfast. A very good morning to all the respected dignitaries and speakers and the distinguished faculty, researcher and the enthusiastic participants. It is with the immense pleasure and the pride I welcome you all to the IPSCON 2025 pre-conference workshop on the emerging tools and technology alternatives to the animal models. So we are heading today with our third session, that is on the leveraging computational approaches in the biomedical sciences. Today marks not just an academic gathering, but it is a celebration of the scientific innovation where computational meets biology and the theory evolves into the translational impact. As we stand at the convergence of AI, network pharmacology, in silico modeling and the molecular stimulations, as well as the advanced predictive analytics, we acknowledge that the future of the biomedical sciences is being rewritten in the one algorithm, one data point and one discovery at a time. So this workshop brings together some of the most accomplished minds who have pushed the boundaries of the computational drug discovery, health technology and the system biology. This work not only inspires but also equips us to rethink that the way we approach the scientific challenges in the today's world. So with this we officially begin the today's session on the leveraging computational approaches in the biomedical sciences. So let us step into the space where the data becomes insight, molecules become models and the science becomes a shared journey of the discovery. And with our first session, I will like to introduce, and it's my total honor to introduce someone who truly embodies the fusion of a chemistry and the computation, a national award winner, Dr. Nilima Dhingra is an associate professor with University Institute of Pharmaceutical Sciences, Punjab University, Chandigarh, from last 23 years. She received her PhD, Master's and Bachelor degree in Pharmaceutical Sciences and joined the institute as an assistant professor in 2012 in the Department of Pharmaceutical Chemistry. Trained as a medicinal chemist, she symbolizes and synthesizes new chemical entities while working on the molecular biology and pharmacology of the hormone-dependent cancer by integrating different computational tools. Her creativity in the research work has been recognized with 78 scientific articles, 3 US, 2 European and 5 national patents, as well as she has 2 books and 8 book chapters in her account. She has been conferred with the 13 awards including DST Young Scientist Award, Bharat Ratna Mother Teresa Gold Medal Award, Indira Vasudevan Award for her achievement and contribution in the field of cancer research. She has accomplished and handling government fundings from the different government bodies including UGC, CSIR, ICMR, DST worth of rupees 2 crores. President of India also conferred her with the National Award of the Individual Excellence Award as a Sarvashresth Divyangjan on the 3rd December 2022 for her contribution in the academic and research. She is selected as a National Academy of the Science, Punjab Academy of the Sciences and Association of the Pharmaceutical Teachers of the India, and she is also a coordinator in the Equal Opportunity of the Cell for the Person with Disability in the Punjab University. So with this, I honored to have you here, ma'am, today, and I totally request her to set the scientific momentum of the day, and I hand over the dais to you.
Thank you.
Thank you so much.
Actually, when such students read, they make us emotional, and but the time to time it also give you a feeling that you should work more hard to maintain that status also for university, for students, and the big responsibility has been given. So now that because the time is already, we are running around. So if you look into always it is my nature that I ask the kind of the audience what we are having over here. So because the theme is the pharmacological sciences, It is International Pharmacological Sciences. And no doubt, if you have heard Saloni, I am basically background, my is medicinal chemist, where we people are synthesizing some new molecule. Am I audible to you all? Yes. Is it okay? Okay. So where we people are synthesizing new molecules. And even I have stepped into this area of the computational around 10 years back, where I myself learned all these techniques and with the help of my students, because they are more challenge to us, and we have to keep that momentum continue. Now, computational pharmacology, if you look into the computational pharmacology, I am lucky to have Dr. Sangeeta, Dr. Anil in my department, and their ecology. They forced me to step into the ecology, and hardly anyone knows me that I am a chemist person or I am a ecologist person. So my recognition is chemcologist person. So with that background, so yesterday I was again talking to like some of the people are the like pharmacy, we all are pharmacy people are sitting over here, they are doing pharmacology, some of them they might be having the chemistry background, and like ma'am is there, there are MD people are also there. So what is common amongst all this, whether I am a pharmacist, medicinal chemist, I am synthesizing some new molecule, I am giving my new molecule to the pharmacology people, they are testing on the animals, and once the the molecule is there or the drug is there, then the doctors are prescribing the molecule this to the health. So what we all are doing together, we all are directly and indirectly, whether it's me or the pharmacology people or the doctor MBBS or MD doctor, we all are serving the society, human, for their health by using one common word, and that is called the drug, right? So if I ask you what is the difference between a chemical and a drug, right? This is my favorite question to everyone. Journey from a chemical to the drug is what? It needs a target to act on, where it by interaction by on that particular. A chemical is drug when it is showing certain activity on the target. So chemical versus drug is the all the what are the drug? All the drugs are chemical for sure, but all the chemicals may or may not be drug, and depending upon the interaction with the target, whatever the target we are all having different type of the target. Maybe it's ion channel, transporter, RNA, and many more molecules there. So if you look into the drug industry, they are all the small organic molecules. They are complementary in shape. This is a very important. When I say that a chemical is interacting with the receptor, what is important? They should fit in with the receptor. Very first important requirement is that they should interact with the receptor. They should have a shape in such a way they should get fit in. But another important is that they should have a charge opposite to that. If it would be okay, if it is having a complementary shape, that is getting fitting, but if it is positive in nature, this is also positive in nature, that will repel each other. So all the what we need to understand, a drug is nothing but it's a small chemical that is complementary in shape to the receptor or the target, desired target, and it should have the opposite charge, right? So chemistry is there, right? And maybe you people are pharmacology, you people are pharmacologists. Even in fact, my molecule doesn't hold any value until unless I am testing them on the animals or what. So we all know that in order to bring any chemical into the market, there is a long journey of how many years? 15 to 20. That's a traditional conventional way, right? We start from the identification. Until unless I am not aware of the what kind of the disease it is, what type of symptoms are there, what are type of the pathways are being involved, how would I come to know what type of the molecule I need to design? So the traditional conventional ways were that okay, like we are synthesizing, a medicinal chemist used on synthesizing number of the molecules, then they test on, that part is called the discovery part. After once it has been discovered, right, we need to test it on the animals, then preclinical, clinical 1, clinical 2, clinical 3, and ultimately formulation need to design, filing after the IND, it comes into the market. We all agree with that. It's a long journey of many years and investing $1 billion. Right? So drug discovery approaches, we chemist people are like synthesizing molecules, but nature is one of the biggest source, right? Nature is one of the biggest source. If we talk about the tulsi, if you remember your COVID timings, what happened over there? The moment before any drug came into the market, everyone tried the kara type of the solutions at their places. Mama used to take moti ilaichi, choti ilaichi, whatever that comes into adrak, whatever that was, and with that. So basically, it's our human tendency that we always try to get the solution from the nature. Now, what is present in the tulsi? And because tulsi is having number of the component, but we need to isolate that particular component that is responsible for the activity. Okay. Now, if it is known, do you think by cutting the tulsi by all the plants, from 1 kilo of the tulsi, I can extract hardly 100 milligram of the active constituents? Do you think that by cutting all the tulsi and getting the product in a milligram level, am I able to serve the society of the 140 crore population of India? No. So that's why nature inspired us that this active constituent that provide the lead molecule to us, but we need to find the alternative in the chemistry lab how we can synthesize such molecules. Again, here it is chemistry. Okay. So sometimes serendipity researches are there, like penicillin is there, and we used to combine. So already, let it say, if aspirin was there already in the market, and aspirin earlier it was used for the headache, and then we try to repurpose the drug for the heart diseases also. So there are the different type of the drug discovery approaches. And no one can deny, especially the pathology people or me, I am being a medicinal chemist, I know that my chemical, if I have chemical, I have synthesized some new chemical entity. Now this chemical entity to become a drug, I need to evaluate its efficacy on the animals. And from yesterday and from past many years, we know that we are having a wide variety of the animals models. It's a rabbit, guinea pigs, right, rabbit. In our times, we used to work on the dogs and also the sheep also, okay? And now the smallest animal model, zebrafish, you people are working on. So look into the complexity and the simplicity of what you are looking for. So we know that we people are using the animals in order to understand how the drug will behave in the body or how the body will behave to the drug, etc. So bioassay and the preclinical testing of new drugs. Is that okay? So research is, and we need these animals. We cannot, this is called experimental pharmacology. Animals are used in this science for in vitro and in vivo. Ex vivo also? Ex vivo also? Ex vivo is an animal part or not? Does ex vivo studies involve the animal part or not? Ex vivo. We are taking the organ but doing it outside the practical. So it's also involving the animals. In vitro, in vivo, and ex vivo, right? So we are using these animals, and you also agree to me that while doing all these animal studies, somehow directly, indirectly, we are putting some stress to the animals. One of my students is working on the hypertension, and she is inducing the hypertension in the animals. So like we are inducing, and the moment my student open the door, the animals get scared all of it. So intentionally, unintentionally, for our PhD thesis, for master thesis, we are putting pressure on them. We are putting them ethical. So that's why ethical guidelines are continuously revising day to day time, right? So sometimes we need to make them deprived of the food also, right? And subjected to psychological stress. So difficulties, yes, I am a medicinal chemist. I cannot do the pharmacological studies by the way the moment the pharmacology people can do it. So definitely expertise is required. So that's why multidisciplinary approaches are coming in the figure also. So now from past many years, if you look into in order to overcome this burden of the animal difficulties or the complications while using the animals, there is a 3R strategy. I hope you people are all well aware. It's not a new word. 2017 and 18 onwards, this strategy is in the picture. That is 3R. 3R stands for refinement, replacement, and the reduction. Okay? So no doubt, we cannot say that if someone will say, okay, ma'am, you give your lecture in the YouTube and you replace yourself. Government will not pay me the salary. I have to deliver my lecture. So human integration is always required, but yes, YouTube is helping me. People are recording me on my lecture, and it may pass to the number of the people also. So similarly, in order to that refinement, we need to find out the solutions that will give the less pain to the animals. We need to find the models that way we can reduce the number of the animals. We need to find the methods we give the less pain, or we need to find the less number of the animals. Now, and our IASC committee, every institute is having IASC committee, Institution Animal Ethical Committee. So now they are insisting to please come up with some computational predictions, because we people are the medicinal chemists and we used to synthesize minimum of 30 to 35 molecules per year. If on an average I want to test each molecule, then we know that in order to bring I need to test them on the minimum 3 doses, and for one dose I need to do then a triplicate. Further I need to do it in the different groups. So on an average my one PhD students require 200 animals, 200 to 250 animals. That is story of one candidate. So 70 students are present over here in the department, PhD scholar, just multiply with that. And pharmacology people even know needs more animals than medicinal chemists. So the thing is that if, yes, I know that the reduction or the success rate would be comparatively less. How I could know, like out of the 30 molecules, all the molecules would be potential, until unless I will test them. This was the earlier trend. So Animal Ethical Committee and the guidelines, they are CPSCA guidelines, they are saying please try to find the alternative to the animals. And since yesterday you people are here for the alternative methods, and one of the alternative method is the computational tool. So that's why the in vitro, in vivo, ex vivo, and now it is the in silico. Okay, ji? So do you think the computational pharmacology, it's a pressure and force, or it's a time to evolve? It's a time, high time, right? Because if you look into the journey after the number like preclinical phase 1, phase 2, phase 3 and number of times, if we synthesize around 10,000 molecules, hardly one molecule reaches to the market. So success rate is very less and the risk factors are very high. Okay? And in order to, and with the time, if you look into the earlier times and the present time, volume of the data is continuously increasing. In order to handle the human capacity, now it's over. Now human cannot handle this much data by manual ways. We all are using. If I ask you, earlier we used to keep the phone records on a diary. Where is diary? If I ask you, okay, recall the one, you must be remembering only one phone number or two number, your parents, your mother, brother and sister. Beyond that, your memories are going out of the storage. Right? So volume is getting increased and the global requirements are getting increased. In order to handle and address all these, number of diseases, many of the diseases are unaddressed, right? And challenges in the timely processing. If we recall the COVID timing, there was a time when the people were dying like anything. If we say, okay, in order to discover the drug for the COVID, it would have taken a number of years, by that time, word would have swiped out. Right? So in that way, so it means in order to handle these all issues, there is a need of the integration. And that's why we need to involve. And what is this integration? Here the IT people are there, biologist people are there, medicinal chemist people are there, stats, algorithm. If you heard about yesterday, Dr. Panda's word, he clearly said, it's not only mere, yes, I'm a medicinal chemist, I know about the laptop only, it is, okay, this is a screen, this is keyboard, and this is a mouse, that's it. Or maximum, I am having a software is there with me, I would be doing the instructions what is given by the software industry. Beyond that, what kind of the statistics involved, whatever the algorithms are known, I am not that competent enough to train you, right? Is that okay? So that's it. But it is the beautiful integration of what? How many sciences? It's the science of math, stats, right? Physics, chemistry, biology, pharmacology, everyone is there. I'm medicinal chemist. I know that. But if you ask the IT people, okay, what is the structure of the benzene? Then they won't be able to answer what is the structure of benzene, right? So look into, here it is the simple example. If you look into, if I ask the audience present over here, what you can see on the screen, आपकी पहली नजर जाएगी mosquito पे, but the computation people will look into the 010101, right? So this is the beauty of the integration, that computer people are helping us that how to project all this data in a way that is visible to a common layman language. And these algorithms are and rising with time. So this is I always love this picture, very simple way, right? So computer sees 0101, and hardly, it would be too tough for us to remember the sequence of 101010 to get the picture of the mosquito. But for you, eyes comfortable is what? Mosquito. And that is the integration. And that is called the integration, because the data is getting big. And so from data, like if I'm medicinal chemist, some people are sitting over a doctor over here, right? If I Google out one word, let it say if I give you one example of paracetamol. Now, ecology people will see into like one pathway how the paracetamol is working. I, being a medicinal chemist, I will look into how the paracetamol is being synthesized. My approach in the same, and in the Google, if you look into paracetamol, just add the paracetamol word and look into how many pages you can open the. Google will give you around more than 1 lakh pages for the paracetamol words. Did you ever try to visit the 1 lakh pages? I can guarantee you, first 20 pages se aage koi nahi gaya. And within that 20 pages, you look your interest. I'm a medicinal chemist, I will look into one way. Ma'am is doses point of view, so she will look into, or ma'am will look into the animal models. So everyone is having its own and her own perspective, right? But again, if I am giving my data to the IT people, that's why IT people is getting them stored on the system, and from that storage, you people are retrieving the information of your interest, then you are applying this knowledge into your practice, and this is how we are applying, and wisdom is there. Is that okay? So we are collecting the data, IT people are storing, again you are retrieving, and you are applying this knowledge into your fields, and this is how that is called the from data to discovery. So multidisciplinary foundation, yes, all the fields are there. From data to discovery, it's okay there. So this, with this people, and if the same journey from the disease till the market clinical trials, computational tools are helping us. It's not saying can be replaced. They are saying computer aided. Aided means helping. They are not replacing it, my dear all. Computer aided drug design, computational tools are assisting. But if you will say they will completely swap it out, then it's maybe time with the aane wale time mein hoga. Agar in case we, the AI Japan, the way Japan has developed the AI based, robot based totally hospital is there, you never know tomorrow the robots will be doing the drug discovery for you people also. Time is not that far. The way hamari jis tarah se speed chal rahi hai. So all these states of the drug discovery, the earlier picture I showed you, now are being aided by the computational tools, right? I am into chemistry people, I will look into, do you have any pointer with me? Okay, so lead discovery. I am a medicinal chemist, I would be looking for the tools that are helping me in the lead discovery. But you people are into the pharmacology, you may be interested in the target identification and preclinical testing. So depending a bit, all we are related. I am a nature is inspiring me, chemistry people are synthesizing, ecology people are testing it, and statistics people are formulating this device. So ultimately we cannot say that we are separate. Together we all are working to bring one molecule into the drug after getting inspiration from the nature. Now, and all these steps have been, so computation is not restricted to the chemistry only. It can be used by the statistics, it can be used by the ecology, it's by the biochemistry people or anyone. So all these techniques are there, ranging from, okay, I don't know things are working or not. Bioinformatic research, you might be, all these are different tools of the computational that are help that you people can use in starting from QSAR, library docking is there, de novo drug designing, QSAR pharmacophore modeling is there. Yes, some of the maximum of them they are presently in the from the chemistry aspect point of view. But if you ask me that ecology people, what kind of the tools they people are used, and they are the primary is the most probably the most commonly tool the ecology people are using is the docking, right? Docking. And the easy way to make you understand the ecology people, if the young generation or the graduate people are sitting over there, that is the lock and the key system, right? Fine. Number of the, like if you are having number of the keys and if you are having one lock. Is it possible? I think if you are having the picture of the lock and if you are having number of the keys, or you are having simple lock, what is the easier way out of these two to find the solution to open the lock? Lock is there and one person is having 10 bunches of the key, another is having only locked, then what is the best solution? Out of these, which one is the easier approach? One having the number of keys. So by looking into the structure of the key, okay, that this is small, this is big, and at least you can filter out and reach to the number of it. But rather it is a totally new, this is totally new, and then it is totally, it's a lock system is there, and in order to find the structure of this new molecule. So that is called this is called the structure based drug designing and the ligand based drug designing. Okay, structure based drug designing, we says that we are having the structure of the protein where you people want to work. If the structure of that is known to you, then it is really good to know. Okay. Ligand based drug designing is a more of the synthetic chemistry approach, so I will not going into that kind of detail. Okay. So now the most commonly tool that the pharmacology people loves to do or their people are applying is that's why here I stepped into the ecology people when Dr. Sangeeta approached me and number of the other people approaches me. So docking is not simply, it is not only the interaction of the drug and the receptor. You people are doing like what we people are synthesizing the new molecules, then we put it in the animals, and after testing out for number of the days or the months, 6 months trial, we got to know out of the 35 molecules, only one molecule is giving me the activity, yes or no. So I have put my number of the molecules, but now these 35 molecules, I will be testing them in hand on the computational tools before putting them on the. So by this way, what would I get? I will get the best molecules that are showing the good results. So let us say out of 35 molecules, I got the top 5 molecules that are showing the better activity in the docking studies, and then we will take a put on the. So by this way, we are reducing the number of animals. Am I or not? Right? So there are the different approaches, like we can predict the, how we can predict the prediction of the adverse reactions. If you remember, like if there is a 2 target, my molecule should react on this. Interaction of the molecule on the desired target is the efficacy. Interaction of the molecule on the undesired target is the adverse effects. So again we can choose that. Until unless if you want to do the same studies in the animal studies, it will take number of the years, but computers are helping us to do all these studies in advance. That will save our sources and the time. Okay. So polypharmacology, I will give you one example out of this practical. Repositing also, again I am having the one story out of this. Virtual screening, target fishing and the profiling is the reverse docking. Now in the docking is that you have one target and number of the molecules. But in the reverse docking, what is it is? You have one molecule and the number of targets are there. Okay. So this kind of the molecule where it can interact with, so accordingly you have to show it. I need to rush because the naked source, okay. And another is the secondary drug properties, that is the physical properties prediction. If you look into these two columns, chemical space and the physiological anatomical space. In this world, we are having millions and billions of the chemical structures. If I ask you how many organs are there and how many type of the cells are there, complexity of the human body is there, 40 organs are there and 400 cell types are there. And in one PhD project, you can hardly check one pathway or one organ. Am I okay? Do you okay or not? You can hardly check. Now, in order to bring that molecule, it's checking on the one organ is not sufficient. Definitely, you need to check the efficacy. I always remember my question for my PhD Viva. For my first question was by my examiner, Nilima, that you have synthesized a molecule for the prostate cancer. You checked it. You have shown the good efficacy. But what about the toxicity? What about the specificity on the other? I was so confident, yes sir, my molecules are so good, they are have shown a good efficacy in the prostate cancer, I got the patent. He said, did you check it on another cells? So my time tenure of the 5 years didn't allow me to check it on the another part. Same way it is possible for all of you that in a given tenure of the 5 years, you cannot do the studies on the 440 organs and the 400 cell types. But in order to bring the molecule into the market, you have to get the data from all these studies. Okay? That's why one student followed by the another student, and cumulative studies will bring up the one people is working in the ecology, one another people is working on the biochemistry aspects, pathways are studying, some are studying at the genomic level. Collective studies will bring the one molecule into the drug. So it is not possible to study one. Definitely we have to bring, and the number of the drug failures जो हमारे पास होते हैं, one molecule in 10,000 synthesis only reaches because 37 of the percentage of the molecule that fails is because we could not complete the ADMET properties. We need to understand the drug and doses at the pediatric level, geriatric level, then the you can say disease condition, male, female, and the sex organs, etc. So, and all use of all these technologies are helping. FDA has already passed out the conditions that FDA proposed predictive toxicology. In 2017 and 18 onwards, they said, please start adopting these technologies in your research. Computers are replacing the animal testing. You all agree with us, right? It's not replacing, it's reducing the number of animals, I would say better, right? So in silico toxicology, in silico clinical trials, and if you Google it out presently, number of the articles are there, and what is that indicating that these use of this technology is in conjuring the image of the advanced research. And we are applying all these different, be it docking, be it homology modeling, right? Then dynamics are there, different type of the QSAR, docking, homology modeling, repurposing, virtual screening. We are using all these technologies in our lab by using the Schrödinger software. And quickly I will go for the polypharmacological one very quickly, because they are some of the PGI students, I look into the detail that they are working on the malaria also. So beta carbolin derivative, if you look into the picture, there are all the bulbs are there, and purposely it has been used, one bulb is lighting. Anyone can understand the meaning of this? Number of the pathways are there, but when we test them, in order to check that if a particular disease is there, the disease can happen by the number of the pathways. And in order to find it out whether my molecule is working on which pathway, no doubt, rationally I would be designing my molecules for one pathway. But in case if you are just having pathology people are there and number of the pathways are being involved, and if you test your molecules by using the computational techniques, you would get to know that which pathway would be more progressive to take it further into the trials. So polypharmacology involves the interaction of the drug molecule with the multiple targets. Okay, and exhaustive in case I have to do the same in my practical lab, definitely exhaustive in vitro, in vivo studies are there. A huge amount is being involved, and sometime we left with the incomplete studies also. So vector-borne disease, number of there are there, and one of them is the malaria is there, having a sexual and asexual cycle is there. UNAD, it is one of the serious health problem, and around 75 million cases with the number of the deaths were reported. New malaria controlling project. Okay, before that, approximate deaths of the 75 million. That's where. So you know the artemisinin, again nature-inspired molecule is there, artemisinin, and artemisinin having the viability issue was there. And again artemisinin, like उससे पहले क्या था, quinine थी, chloroquine थी, उनके साथ क्या था, resistance develop हो रहा था. When artemisinin came into the picture, artemisinin is good but it is short acting. In order to cover up both the issues, a viability issue was there. So in order to cover up both the things, they tried to combine ACT, artemisinin combination therapy. Right. So this was the approach, and nature was like when we working in the chemistry, like being into the chemistry department. So there were the number of the carbolin derivatives were reported in the literature with having broad spectrum of activity, and we synthesized some of the molecules in our lab. My collaborator is there, and when we tested them, now we got to know that in the malaria, these are the 5 different targets are being involved, and they are controlling the malaria by different pathways. They were controlling the pathways. I could not, already 10 minutes are up, I need to rush. So they are the 5 different pathways were being involved in the malaria. So on which molecules, my molecules are going to act better, and for which then that's the multi-target polypharmacological approach, we approach it. And when we did the docking, I have already done the last night homework, red, green and yellow. Red means the compound shown the very weak activity. So from that I can make it out that okay, my molecules are not showing activity against the 5-NFR, 5-NF systolic metabolite dehydrogenase enzyme. And then green is the one, a clear signal. From that I could make it out that molecules are showing very good, all the molecules are showing very good activity against this particular receptor. But another observation that all the molecules are going -8 and -34. So I have highlighted the 3 yellow. This is the molecule that has shown amongst all the newly synthesized molecule, this was the one molecule 9A that showed the activity against 3 receptors at a high activity than the artesunate was the reference drug. From we applied the polypharmacology. From this we got to know one of the receptor on which our derivatives are not totally working, one against which all they are highly active and all the molecules are, but one molecule was showing activity against the multiple. Now why I chose that? Because if my molecule is having tendency to combine with more than one target, it would help me to work better than the working on the single target. So that was a multi-target approach, and that these are all the results. It's not only here that the in silico part, definitely in silico predictions need to be correlated with the very well with the in vitro and in vivo studies. And we done the, Dr. Sangeeta is my collaborative partner, in vitro differentials. So all these like in vitro plasmodial activity against falciparum. Why the falciparum we chose? Because this is one of the most common species that is spreading the malaria, and against this the resistance has been developed. So these all are the results, and you can say in order to bring into the molecule, it's not only that it should have the potency, oral efficacy is also. ये क्या हुआ? Click to cancel. Okay. So let me, this paper has been accepted in the Journal of 19 Impact Factor, right? So if you look into we started with the number of the molecules, we filtered it out, then we did the studies, and collective studies helped us to filter out one molecule, and that we filed for the patent also. So this is the beauty of that, rather than doing the studies on and rather than killing all the animals. Now, I am not going into the second study because already time is running out. Sustainable development goal, for which we people are here. And I hope your sustainable development goal 2015 में ये रखा गया था, जब US ने head of UN United States, they said there are collective 17 goals are there for which we need to work. एक इसमें health है, एक इसमें resources है, एक इसमें innovation है. If we look into the 3 all parameters, health, we are working for that. Innovation, we develop the new molecules. And क्या कहते हैं, resources, yes, we are reducing the number of resources by using the computational resources. So 3 pillars of the sustainable development goals are there. What? Society? Yes. By doing this research, we are trying to help to the society by providing the new molecule to the industries. Environmental, we are taking of the environmental condition, we are reducing the number of the animals. And economic, yes, if I have reduced the number of the cost, I think by working on all this, rather than synthesizing 100 molecules, rather than synthesizing 10,000 molecules, we just synthesize 7 molecules, and out of that 7 molecules, 3 have reached into the patent journey. So I think economically we are justifying that. So empowering young mind to transform the pharmacology for Viksit Bharat. So this is the time. Viksit Bharat, how we see the Viksit Bharat. 1947 का जो एक image we are preparing, that how the India will look into the 2047. This is the time that we need to align with the vision of the Viksit Bharat 2047. There is that makes India a developed and self-reliant country. This is the time that you should start adopting this, getting started today. Start adopting these tools, right? Your roadmap to computational propensity. So, create a drug bank, try molecular docking, practice with the real data, and experimental with Swiss. These all are the, you can say, starting tools. Beginner-friendly tools are there. I should have reduced my earlier content rather than focusing on that, but I will try to cover the same content during my workshop in the afternoon. So what are the computational journey, what are the free tools, and we will try to give you the hand-on demo on these tools in the afternoon. This we assure. So Swiss ADME molecule use journey starts on, and tools for clinicians are also there because number of the student doctors are sitting over here. Okay, so tools for research students I was having, and it's not only that you apply for it there. Number of the jobs are waiting for you people. Number of the jobs are waiting for you people. Who is hiring? Hospital AI units, pharmaceutical big companies are there, AI new startups are there, and contract CROs are there. They all need that. If you look into my country, they are looking for the pharmacology people with the computational proficiency, and the jobs are waiting for you. Okay, so, and who is hiring, and market demand, what is the scenario of that? Presently, AI market or the computational market is of the $5 billion, which is expected to reach by the $25 billion, and salary premium, if the one person रोज Instagram पे एक advertisement आती है, AI, two persons are there, one is with the normal background and one person with the computational pharma proficiency, then definitely there will be a hike in the salary. ठीक है जी? So there are a number of the pharmacology people that you should get inspired from them. Dr. Eric, who is a cardiologist. Basically, he is a cardiologist. Dr. Atul Bhutte, director of Baka Computational Health. Dr. Siddharth Mukherjee, oncologist. But they all are applying. AIMS, machine learning team is there. So these are some of the inspirational personalities are there who all are from pharmacology background. They are using the computational tools. Get yourself trained start it from today. Number of the jobs are waiting for you. And with this, and definitely we will try to help you to give the little hand-on experience with the today afternoon. Thank you. And if you remember my earlier pitch at the very beginning, I gave you that. Okay. Now look into this is the traditional way of the person is synthesizing, the oncology people are testing on the animals, and the doctors are prescribing. Now if I ask you the same picture, time is there, all are having a background of computational tools. Be it me, be it pharmacology, be it doctor. You all have, the time is there, adopt computational pharmacology for Viksit Bharat. Thank you so much. 15 minutes up. And sorry, my one slide that was too important. If you forward, please forward it further. नहीं लगी? Please here. हाँ, please यहाँ पे it is really important to acknowledge because of these students we can project these slides. ये research करते हैं तो हम दिखाते हैं, right? Sometime we did it. लेकिन आज जो भी ये slide का content है, all my students are there who worked it, and my collaborator Dr. Sangeeta, Dr. Tanzir, Dr. Nunal, and next speaker Dr. Subhash. He is already there. He will take you to another level of the bioinformatics. With these words, thank you so much.
Thank you so much, Neema ma'am, for the remarkable start and of our scientific journey today. And your talk was very insightful, but it was also a masterclass in how computational principles can transform the pharmacology from the hypothesis driven to the predictive and the precision guiding. Your clarity, your depth, and your passion have truly elevated the academic energy of this workshop, and we are privileged to learn from you. So,
It's okay.
So now
let's wait for it.
I respectfully invite Dr. Subhash Mohan Agarwal to kindly help us felicitate Dr. Nilima Dhingra
That will
with
be
a
honored.
token of our respect and to present her with the certificate to honor her. And I also request them to remain at the podium for the photographer.
That's a big honor for me that I am always look forward that we approach each other. We never see, and after 5-year journey, we are seeing for first time meeting each other, right? So that's the in silico meeting is turning into the experimental validation.
Thank you.
Thank you. So we started our journey on the computer itself. We just approached to each other on the mails and etc. We did the collaborative work, and today, after I think 4 years after our first time, we are meeting each other in physical way. Thank you so much.
Thank you. Now,
Priyanka?
moving forward to the next talk of the session. Our next speaker is Dr. Subhash Mohan Agarwal, who is a visionary in the computational biology and is presently working as a scientist at the ICMR National Institute of the Cancer Prevention and Research in Noida. He has a several contribution he made in the drug discovery and in the area of cancer by establishing the various computational tools and databases. He has published over 7 index journals and also reviewed the several international journals. Dr. Agarwal has received funding support from the various scientific bodies including DBT, DST, DHR and ICMR. And Dr. Agarwal is also a member of the National Academy of the Sciences, India, and is a recipient of the IUBM Young Scientist Award, Japan, DST Young Scientist Award, DBY-IYBN, Biosolve IT Scientific Challenge winner in Germany, and as well as a recipient of the ICMR Shakunta Amir Chand Award. So with this, it is totally honor to have you here, sir, and with these words, I invite you to deliver your talk, sir.
Thank you. Thank you, Dr. Nilima. I need to thank first having a little chat. So I'm not going to, although I have slides, and while I was seeing Dr. Nilima's presentation, whatever I was supposed to discuss, she has already discussed. So, and it's very simple for me saying that she has discussed about docking. You will see the same slides there. She was talking about structure-based drug design. She talked about ligand-based drug design. She talked about dynamics. She also touched upon, in a sense, machine learning, QSR. So these all topics have been touched upon. So can I reverse the way I am supposed to take a talk? Is, can you really tell me what you are looking for? See, you people are sitting here. One way is that I introduce you to certain topics. Is there something that you have come here? Like first time you are hearing these terms? If most of the people are like hearing the term first time, then it's a different thing. But if you have some, I would say burning questions, if you have something that you would like me to tell you by virtue of my experience, then I can tell. So,
Your own words, your own experience.
So, I am a pure computational person, right? Although by training, I am an experimentalist, I am a pure biochemist. To bioinformatics, but very early. So, conceptually, I am a biochemist, and by training and by working, I am a bioinformatician. So, people need to understand when we show what Dr. Nilima showed, that how drug discovery used to happen and how it is going to happen or it is happening, and there is going to be a further shift in that with the emergence of AI. In my own sense that I see how things are evolving, next 5 years is going to redefine the every area,
even biological sciences. Be it we can keep on saying medicinal chemistry, we can keep on saying biochemistry, we can keep on saying pharmacology, anything we want to work on. Everything is going to be changed the way we are going to think now. So, especially students, if they are doing M.Pharm, B.Pharm or are even doing PhD, they will have to start thinking afresh. And I really mean it, they have to start thinking afresh. Don't look at your seniors. Don't look at least who are 10 years ahead. Forget them. That branding, that style will not work. If you think that you will survive by looking at them, I am sorry, you are going to get finished. So, everything is changing and it is changing very, very rapidly. With AI, for example, when I started doing bioinformatics, I know that yeah, 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 not many people were doing bioinformatics. So, I could survive in a certain sense, but now my only worry is I see the things changing rapidly. Okay. So, what I wanted to discuss was what is docking basically, dynamics, machine learning, network biology, admit screening, and by virtue of some case studies can I show how they are being used, right. Okay. This slide more or less has been shown. So, just to point out, if I can, board is not taken, board पे आ नहीं रहा है, fine. If you see the first step marked in yellow, drug discovery, we have listened to it that it takes lot of time, lot of money. That is true, but things have changed. So, what wherein bioinformatics or wherein computational tools comes into play in reality, in my own perception, is basically each and every step marked in yellow, which is target identification, the discovery, the optimization and the preclinical testing. This is where mainly I feel in academia we are working in these only areas. And this area depending on how you utilize them. So, for example, lead identification till certain time back or even now was happening through molecular docking, right. But identification and optimization, and for optimization we were doing something called QSR studies. So, you have heard the term quantitative structure activity relationship studies, but machine learning has transformed that. So, if you see in my slide I have written lead identification molecular docking slash machine learning, again lead optimization QSR slash machine learning. So, both the things are being taken care by machine learning. So, if you can develop machine learning based models, things are happening now, right. Okay. This is one typical slide which I show everywhere. It's my pet slide, and because why I say this is my pet slide is it defines everything that I have learned actually. So, we will just keep getting back retrospectively that typically drug target identification, even if we have a known disease, for example, we talked about COVID. If we have COVID, we have to have a drug. For having a drug, what is important is to know what is the drug target. What is that we are going to target in order to inhibit that particular protein, so that the activity is reduced, and assumption is that activity is related to the symptoms, the disease, right. So, some time back we had this genomics approach, where we still do it, is comparative genomics approach. So, what I am trying to tell you is identifying the disease, for that we used to have some traditional ways which are being now removed by genomics era, right. So, genomics we do a comparative genomics, that means we compare the two entire genomes itself. So, for example, madam talked about malaria. So, we have a host parasite system, right. So, we take the genome of the host, we take the genome of the parasite, simply compare these genomes. So, we compare, what we compare is not genomes basically, we compare the protein set, right. We compare them and try to identify. So, then here the biochemistry comes in. So, if I ask you what should be the one particular requirement for being a drug target, what would be your answer? When a protein can be called as a drug target? कोई बात नहीं मैडम है. Please respond, otherwise it becomes I can't make out. No. No. I am looking at very simple answers. When a protein becomes a drug target? No. No. Affinity की बात ही नहीं आती. I am just talking of a isolated thing which is a protein. Why you are bringing affinity? Affinity is with some particular molecule. And if how many students are there? B Pharm or M Pharm? Okay, good. Because I will tell you certain things. I am not supposed to talk this, but I like to talk about it. Is in most of the interviews, you are asked some basic questions, and I am telling you by virtue of experience of sitting on this side as well as on that side, they don't have the time. They ask you a basic question to start with. They see no answer is coming. They ask you a second question. They see you are not answering. You have said, okay, thank you very much. You can go. And then those who have been interviewed go outside and say, यार हमसे तो कुछ पूछा ही नहीं. Point is you didn't start, and they will not start at the higher levels. They will start at the basic level. Okay, what is essential for drug target? And I said when I said comparative genomics, the answer lied there. It has to be no. It has to be unique to the parasite. That is a basic essential condition for being a drug target. That means अभी हम बात कर रहे हैं फार्माकोलॉजी के भी लोग होंगे या पढ़ी होगी कि we are talking about side effects. So in the first step itself we had taken care कि side effect नहीं हो सकता, because the chosen target is unique to particular organism. So most of the drug targets become drug target when they are unique. The second and essential condition is they should be, it should be essential to the survival of the organism. If I remove that particular protein from that particular system, if there is a bypass system, that means what we are trying to do? We are trying to inhibit that particular protein so that, and you have to think like a enzyme kinetics whole thing, then the product is not formed. The product is essential for its survival because it is building up some blocks. So if that particular reaction is stopped or that particular protein is inhibited, which we call, right, the product is not formed and the survival goes down, right. So there are two essential conditions for a drug target. Therefore we do a comparative genomics approach A, but herein we also start doing now what is called as network biology. Yes. Then the condition changes in the sense it is a simile then again the protein has to be unique, the protein should have some unique features. It is not that the protein will be completely different, it should have something. For example, in NCDs, in case of cancers, you have mutations. So as a result, the protein is the same, but since because of the mutation we say the active site of the protein has changed. So, that is a sub classification of that classification in a way. That means either it is unique or it has certain properties that makes it unique, right. So, it has to be unique, then only you hit it. So, for example, if you hit something which is very very common, it is like bombing, है ना, मुझे पता है कि terrorist वहाँ है, so I cannot hit the whole city, because this is, see why we say chemotherapy is bad at the moment, because it goes and kills non-selectively. So, if somehow we can devise a mechanism but that it can kill selectively, it will become better, and that is why the nano formulations and everything is coming up, right. The other part what I was saying is network biology. I do not know how many people are even aware of that or have seen. Networks बनते हैं, and from that the concept is very very simple. Just remember एक cycle का पहिया, right. Hindi comfortable everybody? Okay. Yeah. The bicycle, if you remember the tire of the bicycle, and you just remember the middle point, which is hub basically. It is called as hub, and everything is connected to that particular. So, if somehow I break the hub, can the wheel be the wheel, right. So, that is what the condition is. We try to build a network which is nothing like that particular hub, then the connections, and then something called nodes are there, and we try to see that if we remove that hub, that does it disrupts the whole system. So, that is another computational approach that from which people are not trying to find drug targets. Okay. Coming back to second point, now I have the disease COVID, I have the protein XYZ protein I know now. Now, what is needed for drug discovery? We were talking about docking. So, what are the two things that are needed for docking? Everybody does docking, I know. Everybody does now, more or less. What are the two things that are needed for docking? Please tell me. Protein, I can hear one. Very good. So, one thing that is needed is protein, and can you tell me what of protein is needed? Active site. उससे ऊपर थोड़ा चलिए. नहीं, कोई स्ट्रक्चर बोल रहा है शायद, मुझे सुनाई दे रहा है. Okay. So, we need the three dimensional structure of the protein, and we need the structure of the ligand, right. So, that is where the homology modeling comes in. So, there are still many proteins which we know are targets, but we do not have the structures. So, I hope how experimentally people get the 3D structure of proteins. No. I have, please listen to it carefully, and I am not pointing it out, but please respond so that I can tell you. I said how 3D structures can be determined of a protein experimentally. Okay. Which are the two normal techniques by which proteins are determined, the structure of a protein are determined? Yes, the teachers know it, not the students. Now, please do not think when you go for an interview, they are asking silly questions. And I am always pointing this out because I have learned through very hard way, and that is why I want to pass on this message, even if nobody likes it, I do not mind it, right. So, X-ray crystallography and NMR are the two ways by which a protein structure is determined experimentally. In absence of this, we had something called homology modeling, but what madam said, AlphaFold. Now, this is what AlphaFold has done. Nobody knows now homology modeling. So, everybody knows go to something called AlphaFold, just given your protein sequence, something will come out. Always remember computational techniques or all these techniques will lead to certain issues. The issue is you will start forgetting the biology. You will start forgetting what you had learned, because what you will remember is I copied from somewhere, I pasted it somewhere, I clicked something, I got something. But what you pasted, what happened, is the output really meaningful? That will not happen, and therefore, your computational experiments may fail miserably. I am saying miserably. Even if people do experimentations, they design compounds, they make compounds, they test their compounds, the success rate is very less. In addition to that, we are adding computational tools wherein we are making more assumptions. So, probability of success is expected to go down further, but we are doing something unknown errors. We are adding unknown errors to it, and therefore, when you take up this further in experimentation, you will fail even more miserably. So, you have to take care and take it very, very seriously that how you use your computational tools. Don't be blind. It's like मैंने चैट जीपीटी में डाल दिया, उसने मुझे बता दिया, मैंने ले लिया. Okay, fine. आपने ले लिया, बंटा हो गया धार. You have to apply your mind. It's like one quote where I was reading it somewhere sometime back when ChatGPT came, and it said ChatGPT was supposed to wash my utensils and I was supposed to do intelligent work. Now I am washing utensils and it is doing the intelligent work, and it will eat up all the jobs. And I am warning you, 5 years, next 5 years is going to be very, very tricky for the coming generation. हम लोग का तो हो गया. I say very openly, हम लोग का हो गया. Next generation have to be very, very clever now. You have to get your even more basics right. Okay. Now I have the protein structure, everybody knows. Now I want to find a molecule of interest, I do docking, right. I will go to this later on. So, I do docking, I do something called virtual screening, and I find certain molecules which appear to be inhibiting the protein, right. Now, there is something called dynamics. So, docking is more of a static approach, right. Why I say it is a static approach? I say it is a static approach because it does not take into consideration anything except the protein and the ligand, the environment, which is the actual biological system. So, our system is not an isolated system. It is like हमने test tube में experiment करा will not replicate in the in vivo system, right. So, we have done something in the in vitro. So, in vitro similarly, if we have to, I have to run an enzymatic assay, I will take my purified protein, I will take my molecule, I will run an enzymatic assay either by fluorescence, spectrometry or whatever. I will measure the absorbance and say that since my this has gone down, my activity has gone down, right, and I will probably do a plot of Lineweaver plot I will do, right. So, dynamics takes into consideration the dynamic part of it, right. Now, let us say I take that molecule further into experimentation, and I was expecting an activity of let us say 1 nanomolar, right, but I land up with the activity of 10 nanomolar. What do? I redesign the molecule. If I am a, for example, madam, I am a medicinal chemist, I will go to medicinal chemist and say, it didn't work, please redesign it. So, we will see the active site, we will redesign, we will resynthesize the molecule. The other way is something called in traditional computational approaches QSR, right. So, we have something like a mathematical equations are formed. Here a single line basically concept is used, where we have an equation y equal to mx plus c. We from that we try to build a model. What it says, quantitative, structure, activity. So, we have the structure of the what? Structure of the molecules. We have structures of the molecules and we have their corresponding activity, and from that we try to build a relationship, and what the relationship is quantitative in nature, and therefore, this name. So, quantitative, structure, activity, relationship. And using this approach, the QSR approach, we try to build a mathematical model, and from this mathematical model we try to do optimization. So, normally optimization, lead optimization is done through QSR approach, right. And now, even for admit predictions, we have in silico tools. So, we have web servers, you can go in there and just put in your molecule and see that whether they are adhering to the admit rules or not. Because see, if you synthesize the molecule, even if it has good activity, and then you take it further and you understand, अरे जो मैडम से क्वेश्चन पूछा गया था, it is acting against 10 particular proteins, or it is showing some activity which is not desired. Let us put it this way, it is better that I do this activity prior. So, although in this slide it is put up here, I will talk about one of the scenarios, or I will talk about the approach that I like is I try to put it even in the first step, even before you do docking, you just shift it prior, so that the possibility that it shows later on certain issues, the off target issues, is taken care of in the prior steps itself. Okay. In a way, indirectly I have talked about two things, structure based approach and ligand based approach. Can you tell me which one was ligand based approach and which one was structure based approach, and why? In my previous slide. हाँ, रिवर्स कर दिया तुमने, इसलिए रॉन्ग है. Structure based approach requires the structure of the protein. So, the structure has to be known. Also, the structure of the ligand has to be known. Therefore, it becomes a structure based approach. When it becomes a ligand based approach? It becomes a ligand based approach if my structure of the protein is not known, only the ligands are known, and therefore, the QSR based approach is a ligand based approach, right. So, just to put it simply, structure based, the known, if you just see this, the ligand is known, the protein is known, then it becomes a structure based approach. If my ligand is known, but protein is unknown, then it becomes QSR, and we will be talking about machine learning also, right. Okay. Madam also talked about this, Emil Fisher, lock and key hypothesis. सबने पढ़ा है, right? Now, what is the relationship of docking with this? Why I am putting this slide? What is the relationship of this with docking? Is there even any relationship? I am supposed to complete. हम्म, हम्म. Why I am showing this slide? And I am clearly stating it. Most of the students coming for PhD interviews are asked this. We have done docking. They are asked us very simple question. What is docking? And they are not able to tell. Reason is they have not thought about this. बहुत ज़्यादा आपको कुछ बोलना नहीं है. It's nothing but we are replicating this lock and key hypothesis. Docking is nothing else. It's a computational way wherein we try to see whether the substrate or which substrate is fitting best in the binding pocket of the protein. So, we are replicating this process computationally, right. Now, that was the above part. Why I put competitive inhibition part? Any ideas? You people are doing, let us say, docking for what reason? How many people have done docking? Let me ask me this way. Nobody has done it? Nobody has done it. I get you. Okay, so nobody has done it actually here. Then it's a different audience. So I cannot cross question that. Okay. So what docking tries to do, then let me go it this way. Okay. What docking actually tries to do is simulate this particular reaction. So ये enzyme kinetics का ये पता है? Have you seen this? Right? So this is a traditional enzyme kinetics thing, wherein the enzyme is coming with the substrate and forming a ES complex, and ultimately it leads to formation of product which is EP. So, and in the second step what we say is, in what is a competitive inhibitor for that matter? Competitively. So, point is, the name says competitive inhibitor, that means there is a competition between what? Two things, which is substrate and probably the inhibitor, right. So, what we say, a competitive inhibitor is a molecule which put in presence of a substrate, when put in presence of a substrate, leads to competition, right, and binds to the active site of the protein, leading to inhibition of the protein. Basically, it is going and binding. Instead of S, the I is binding, because it is structurally similar to the substrate, which 99% people miss. So, you have to add to your definition, it is similar to your substrate, and this is very important property of a competitive inhibitor, right. So, drug discovery, we said the word drug discovery, I am trying to identify a inhibitor molecule. So, my purpose of doing docking is to find an inhibitor. So, I am trying to do that step, which is E plus I giving me EI, so that my S cannot bind to E, right. Now, if I say, अच्छा किसी ने करी नहीं है तो I cannot say that, fine. Okay. So, just remember this, or if you want to write anything, you write, it is a computational analog of biological screening of compounds. What I want to give a message. What is docking? Docking is a process wherein we try to see, we are trying to find a probable inhibitor by taking the molecule and seeing whether it binds to the active site of the protein or not, and it is analogous to biological screening in the experimental way, right. Okay. Then what is virtual screening? We use both the words. Virtual screening is nothing but a process wherein we have a large library, because for example, as a medicinal chemist I have synthesized 30 compounds, right. So, I do not want to synthesize 30 compounds. The whole idea is I do not want to synthesize 30 compounds. I just want to synthesize, let us say, 7 compounds at the end of the day. So, what we try to do is we try to have many compounds and try to see by docking it in the active site of the protein that which molecule is probably having a better binding in the active site of the protein, and therefore, the assumption is that it will probably inhibit the protein in the process and it will not let the substrate bind into the active site of the protein, right. So, again the take home message is aim is to score, rank or filter. That means what I am trying to say, when we do a biological testing, it is quantitative in nature. That means मैं IC50 निकालता हूँ for example. People have done experimental assays. Pharmacology में experimental assay नहीं होते. So, must have done some biological assays, right? Right. So, you are trying to find, let us say IC50, any parameter you are trying to find, it is quantitative in nature, but docking is not quantitative in nature, it is qualitative in nature. It tries to rank the molecules, it tries to just give you an idea which might be a better fit. So, the idea is completely different here, and therefore, when people write papers or do something, they say we have been able to find a better inhibitor, but we have not been able to find a better inhibitor because it is a comparative way. So, if I take another set of 30 and compare, let us say, it might turn out from that 30 I may find something better. So, therefore, when the idea was given of virtual screening, the idea was that you are supposed to use a huge library, therefore, I have used a word probably large library and not small libraries, because it is comparative in nature. Okay, just a visual demonstration that what is happening in virtual screening. So, अगर शब्दों में समझ नहीं आया, so it's like one molecule after another molecule is going into the active site of the molecule and the resulted is what we call as docking score, right. So, we get, and based on this we are doing the ranking, as I said we are ranking the molecules, and based on this we are getting the comparative score, and then we say that XYZ is the best molecule that we have been able to get. Okay. So, like I said, what is the application of this docking process is, how does your molecule bind? We can know most of the times it is basically competitive inhibitor, right. Although there are now different docking methods are coming up, wherein we also do irreversible inhibition, right. So, normally when docking is done, it is basically competitive in nature, right. What compounds might be good leads? As I said, it is comparative in nature, and therefore, I am trying to find which is a better molecule to fit in my binding site. Definitely comparison of affinities, for example, in the life slide, if I had 4 molecules, we can do a comparative analysis. It becomes important when we have close analogs, right. So, something I am trying to find a 1 nanomolar versus 2 nanomolar. Let us say I did something, I did experimental assay and I was able to find 2 molecules with one with 1 nanomolar and one with 2 nanomolar, and from there I can learn what are the differences between the molecule, and indirectly the QSR comes into the picture, because from there the properties will come into the picture and I can see how the molecule is fitting in the binding site, as well as I will see that what other properties can I change. It can be anything, hydrogen bonding, hydrophobicity, anything can be there. Okay. Normally, what you do if you have done autodock and glide is nothing but semi flexible. So, these are typical questions that are asked actually everywhere, right. So, What kind of docking? So there are 3 types of docking. Normally docking what is used is semi-flexible docking, right? Because why? The ligand is flexible and the protein is rigid. So we are not moving too much the protein. The active site of the protein is not getting moved. So Schrodinger is there. अगर IFD किसी ने करा है, then that comes into flexible docking, right? Okay, this you will be getting taught, right? Again, open source. Autodesk is one of the best softwares that you can use. It is open source. Lot of YouTube material is there. You can easily learn. You can easily do. Don't need to bother too much. The only thing is that where people make mistakes is in their basics and the steps. So you have to think about each and every step. Why that particular step is being done. If you are clear with that, you will replicate it. Else you will definitely make a mistake somewhere or other. Okay, forget about this. Okay, I will finish off with this 1 or 2 slides. Strategy 1, which is the most simple strategy, and select a protein of interest, select a large library of molecules. So I want to do drug discovery, I am a student, I want to do my thesis, M Pharm thesis, B Pharm thesis, even I want to do my PhD work. So what is the strategy normally taken, and it is done, is select a protein of interest, right? Select a large library of molecules. Now as I said, do admit screening first. What most of the people are doing, admit screening at the later stages, because that is what most of the literature is reporting, right? But do admit screening at the first step itself. How it helps? If you are going to do it, you will going to realize that docking, although we say it's not going to be very fast, it will be computationally intensive. You might not have that kind of machines to run. Most of the places we don't have. It's still the reality, right? So let us say I have taken 4 lakh molecules. Let me put it in this perspective now. 4 lakh molecules, each molecule going to take 5 minutes. How much time it will take and how many days on one computer, you think about it now. I am not going to say anything beyond. So what do? You do admit screening. Let us say as a result 2 lakhs molecules are getting out. So else you will be docking only small number of molecules because of the limitations, right? As I have said, take filtered library, then you do standard molecular dynamics and experimental assays. You pick up certain things, certain molecules, and do a experimental assay. This is completely traditional way of doing and nothing bad in it. The only thing I have said here is do admit screening prior, right? Okay, I will not strategy 2. Oh yeah, this one. But I will finish off with this. Just give me this 2 minutes. Okay, now this is a very important question, because people have been coming up and saying to me, and as a computational biologist I have heard this many times, and people say हमने docking करी, हमने molecule करा और हमारा experimental में fail हो गया, and it can happen that you got 5 molecules and none of will be active. Reason is lying here. For each protein you may have many crystal structures actually, right? If you do a overlap of those crystal structures, you will see the active site variation in that. It might be same, it might be different a bit. Why it is different is because of the dynamics of its presence in the solvent, right, which we are not taking into consideration while we are doing docking studies, right. So one way that has been proposed and still not being used much is ensemble docking. That means, forget about the word ensemble, it is a very simple thing that for doing docking I take multiple structures of the same protein and dock my library. Now it adds fun. Let's say I have, what this slide is showing is, in order to do docking, I do random selection. I take any protein I like and do. That means PDB1 ले लिया किसी ने PDB3 ले लिया, किसी ने PDB number n ले लिया. Now let us say I take 3 proteins. Now add complexity to it. I do docking for each of these 3, 2 lakh molecules into 5 minutes. How much computationally intensive it is going to become? Now you think about it. But what it does, and why people do not do it, what it does is, now you take in the standard approach, visualize, I said visualize the best scoring protein ligand complexes and identify top scoring molecules. Now this whole top scoring molecules changes, because from the list, if I have 100 molecules, in one screen the hundreds will be different. If you do it by virtue of experience, you will see 100 जो PDP1 से करा था वो अलग होगा, 100 PDP2 से जो करा था वो अलग होगा, और 100 PDP3 से अलग होगा. Now suddenly you were thinking that PDP से जो करके 3, 4, 5 आए हैं, क्योंकि एक्सपेरिमेंट के लिए लिए टॉप 5 यहाँ पे, वो बहुत अच्छे और एक्सपेरिमेंट में मजा आ जाएगा. बट क्या आपने देखने की कोशिश करी वो टॉप 5 PDP2 में ऑफ द सेम प्रोटीन कहाँ हैं, या PDP3 में कहाँ हैं? Then you will realize is that PDP1 में जो नंबर 1 आया था वो पता लगेगा 50th नंबर पे है PDP2 में, और हो सकता है PDP3 में तो टॉप 100 में ही ना निकले. And therefore people are not doing it because it is computationally intensive. It leads to reduction in false positive, and therefore this strategy is difficult. But this strategy, in my own understanding, is the best strategy, and it really results into molecules which can be really effective. Otherwise हम random खेल खेल रहे हैं. It's based on assumptions. It's like वो तुक्का लग गया, मैंने 5 लिए थे, उसमें से एक आ गया, ठीक है. But the point of computational drug discovery is to reduce this. So I will finish off here, right? So yeah, thank you.
Anybody have questions? Thank you so much, sir, for the insightful session, and you have shown us how in silico intelligence isn't just replacing the wet lab approaches, but is also empowering and accelerating by coming years. And your ability to simplify the complex drug discovery approaches into the actionable scientific standing is truly inspiring, and we deeply appreciate your presence in this workshop. With this, I would like to request Dr. Damanpreet Singh, Dr. Nilima Dhingra, Dr. Rajesh Goyal and Mr. Barinder Singh to kindly help us felicitate Dr. Agarwal as we honor him with a token of appreciation and present him with the certificate. I kindly request you to please come on the podium, Dr. Damanpreet Singh, Dr. Nilima Dhingra, Mr. Barinder Singh and Professor Rajesh Goyal.
So in one line I would like to conclude that I was giving an overview, but sir ने बहुत patiently explain करना, चाहे वो इतना सा आपके बेसिक्स जो थे ना, जो बेसिक स्टेप पे रखा है, आई गारंटी कि आपको वो बेसिक्स करने, मैं खुद कंसर्न करती हूँ, मैं टीचर हूँ, बट मेरे को भी बहुत छोटी छोटी चीज़ें नोट करने को. थैंक यू फॉर योर पेशेंस. So please, Rajesh sir. Sir, since from ICM you. Thank you, sir. Thank you, Daman sir. बस आप आए नहीं करने पहले इसलिए कुछ कर दिया.
So before we move forward to our next session, all the participants as well as the resource persons are requested and are invited for the short tea break. This is a wonderful opportunity to relax, interconnect and re-energize before we continue the post segment of our program, and we will reconvene sharp at 11:20. And so we kindly request all the delegates to return in the hall on time, and we hope you enjoy this time and break and come back sharp at 11:20. Please don't take extra time because we have to move forward to the other two talks before lunch.
Our resource persons are here.
So I first
ये सबसे बड़ी बात होती है कि एक स्पीकर को जो प्रेशर दिया जाता है ना आधे घंटे के अंदर इतना पढ़ाना है, दैट्स अ रियली बिग चैलेंज फॉर अस. हम सर की कोशिश ये थी कि मैं हर टर्म आपको प्यार से समझाऊं, है ना. सो आई गिव द ओवरव्यू. लेकिन ऐसे ही अगले 2 स्पीकर्स बैठे हैं. सो हम्बल रिक्वेस्ट टू ऑल ऑफ यू, प्लीज जॉइन.
Welcome back everyone. It was the tea break. Welcome back everyone. Welcome back everyone. I trust the tea break offered you the moment of the relaxation and the recharge. Now let us gather to our next session and for the insightful talk of the program. I request all the delegates to please take their seats, and our next speaker is Mr. Birinder Singh, a leading expert in the health economics and the outcome research and the director of the Pharmacoevidence Private Limited. And it's my pleasure to introduce him. Mr. Birinder Singh completed the master degree in the pharmacology from the UIPS Punjab University, Chandigarh in year 2014. He has more than 11 years of experience in the consultancy. His area of the technical expertise includes systemic literature reviews, direct meta-analysis, indirect treatment comparisons, Bayesian and the frequential network meta-analysis, economic modeling, and the HTA. He is associated with over 50 plus peer-reviewed publications in the medical and the outcome research journal. He has worked across a wide range of the therapeutic areas and throughout the product life cycle. Prior to his current role, Mr. Singh served as a senior consultant at a large market access consultancy, and later he co-founded Pharmacoevidence in the year 2020, where he steers the evidence synthesis projects, meta-analysis, economic models, and HEOR services in the India. Under his direction, his company has built a team delivering HTA, modeling, and evidence synthesis for the pharmaceuticals, devices, diagnostics, and the biotechnology client. With this, I respectfully hand over the dais to Mr. Birinder Singh and request him to please begin his session.
One time it was there, he was sitting on that end, and today he is delivering the talk. That is an achievement for any teacher. That is achievement. एक पेरेंट्स को तभी फील होता है जब बच्चा जो होता है उससे भी आगे निकलता है. So today is that proud moment for all of us.
Thank you so much, ma'am. Okay, good afternoon, good morning, everyone. So, my session is focused on Gen AI in healthcare, the next transformation. I know this is a buzzword, we all are using generative AI now, either with ChatGPT, Gemini, or all other tools that exist. So, but what is their role in healthcare? So, that is the basic topic. And as ma'am said, I was a student like you. I was discussing with ma'am, I had a friend Rajit, and our role used to be like whatever the duties are given to us for the delegates and everything, and then just look for the tea breaks and the lunch. And when I was kind of listening to the first session, it's like in 10 minutes I got the docking and some other basics that I couldn't get from my previous experience, because we didn't kind of again did pay attention at that time, especially during these. Although it was not my field, it was chemistry. My friend was there, Rachit, but I know he was also like me. Okay, so starting on this one,
Audio is okay to you all, huh?
you can hear.
Can this is relocate conversation?
Is it better now?
It's better.
Okay, I try to be close. Great. Thank you. So, what are we going to cover today? So, this is basically the first thing is healthcare workflows, particularly, or the challenges that we have in the healthcare. That is, we have the volume now as a biggest challenge. The data, data is the new oil. That term was, I think, the term is now being used from the last 10-15 years. But now this is becoming challenging because we have a lots of data in healthcare, and I'll kind of discuss some of the numbers there as well, and how to kind of again expedite the drug development process with that sort of data, with that sort of particularly the regulatory environment that we have. So we know a drug takes almost 10-15 years, but how to expedite that? And what are the innovative solutions? Big data is one thing, then generative AI is the second thing that is transforming this whole process. I'll touch upon this, and also I'll kind of try to deep dive into some of the basic applications. For example, how you can conduct a systematic review quickly, how you can kind of work on some of the reportings, your thesis quickly. I know we are using GPT and others, but are they capable enough? So what are the problems with those? I'll discuss those as well. Just a second, I'm just setting up my system again. Yeah. Okay. So firstly, the data. So we have now more data. Healthcare generates nearly 30% of world's data, and this is huge. Healthcare is just one field across many fields that we have, and this volume increases by 36% CAGR in 2025. So this is faster than we think. Now, the challenges we have is particularly if we just look at the registries or the clinical trials in the past few years, in terms of registries, we can see in the last 1 or 2 years there is a jump of around again 30 to 40%. This again, the data is exploding. And then in terms of regulatory field or in terms of reimbursement field, there are upcoming regulations as well. JCA, I'm sure nobody has heard the term JCA, but I'll explain that. So let me explain quickly where I'm going from the drug discovery to the reimbursement. So drug discovery is we start with looking into the molecules, we do preclinical, we do clinical, and after clinical we go for the regulatory approvals. So regulatory approval, taking an example for India or US is FDA, we know FDA, there is an FDA approval, it's done, the drug is approved, it is in the market. So what happens in India is when a drug is approved or regulatory approved, we go to a doctor, doctor prescribes that drug to us, we buy that drug, we pay for that prescription, we pay for that drug as well. So that is out of the pocket cost. Nobody is reimbursing that. Other, if you have an insurance system, that usually comes into play when you are hospitalized or when there is a large sum involved. But this is not the system in major economies or especially the developed economies. In developed economies, nobody is spending a penny on the healthcare. Except for the top 1%, everybody is using the same healthcare system. And in that healthcare system, you go to GP that is near to you, general practitioner writes a prescription, that drug is given free to you, that test is free for you. But how to decide which drug to include in that, which drug not to include? Taking an example, say paracetamol, it costs 1 rupee. Okay. Now, if I am coming up with my drug, say XYZ, this is a new drug, this is a blockbuster, but doing the same work as paracetamol, this is used for the fever or say headache, taking an example of headache. Okay. So, how can I command more kind of again money for that drug compared to paracetamol? Paracetamol is generic, just 1 rupee, taking an example of 1 rupee. But my drugs cost, because I have spent on preclinical, clinical research and everything, it is 100 rupees. So that gap of 99 here in India, doctor can write that XYZ drug, we will buy that. Instead of paracetamol, we'll buy that, we'll pay 99 more. But if the healthcare has to spend the same, so their budget will increase by 100x almost. Because that drug is free in that healthcare. And now instead of 1 rupee drug, everyone is getting 100 rupee drug. So company has to prove that 99 rupees they are commanding extra, they are setting off that those 99 rupees either with the clinical efficacy or with any other sense. So clinical efficacy can be, giving one example again, paracetamol takes 30 minutes to kind of again help me with my headache. But this XYZ drug takes 1 minute, 29 minutes. And now those 29 minutes should be converted to economics. That if we are giving back 29 minutes to the economy, the productivity of that 29 minutes justifies the 100 rupee cost. And that's where the economic modeling comes in. So here we are mainly kind of relying on whatever drug is approved, it is prescribed, but in major economies, there is another layer, which is the reimbursement layer. And JCA comes from that. So JCA is the European term now. So Europe is coming up together to evaluate a drug in one platform. Otherwise, every country is evaluating a drug at different platforms. Okay, and feel free to ask any questions at any moment. Okay. So with that volume particularly that we are facing in terms of data. So we know there are tools, ChatGPT, Gemini, Claude. I know ChatGPT everybody might have used, but have you used Claude? Anyone have you used Claude? Okay, this is coming from AWS. This is more for the coding. This writes better code, but this is also very good tool as such. But these all tools are generic LLM tools. So that basically means that with these tools you're able to do some sort of work, but are they suitable for the healthcare work as such? For example, if you're working on a project, you have to look for the literature, you have to write the thesis. Are they suitable for that or not? So we'll take a look at that as well. So when we use these LLM tools directly, this is ChatGPT or Claude or Gemini. So they are easy to use. I just need to sign up, or even without signing up, you can use that, right? With sign up, you have the memory, you have a lot of the features. It gives you answer quickly. It drafts you report. You have a letter you want it to write quickly. It can write. Hallucinations. Has anyone faced hallucinations? I just need show of hands. What are hallucinations? So the data that doesn't exist, but ChatGPT is answering that this data is there or that paper is there. Anyone has faced hallucinations? Just show of hands. Okay, so very few have actually kind of tried to check whatever is coming out is true or not. Okay, so hallucinations are the major problems with these LLMs. Whatever you write, it gives you answer for that. Okay, I can give again a real world example. We were working with a company named Otsuka Pharmaceuticals. They came to us. They had to start their registry studies next week. Everything was signed off. So this was a month's work. Everything was done. One of their key opinion leaders, KOLs, came to them and mentioned that you should not consider comparing to placebo or the best supportive care in your real world study as such, in your stats. And they came to us. This is Monday morning US time, our evening. So we are having this meeting where they are saying that within a week we need an answer from you that whether we should use placebo or not. So we need a placebo benchmarking, basically, that what kind of placebo data or BSC data exists in that area. We had a week, 4,500 odd citations, systematic review, meta-analysis, and meta-analysis that too at a KM curve level. We had to digitize the curves and then run the analysis. Friday morning, we were giving them the results. Everything went well. But after my Monday meeting, I went to ChatGPT. I have the best level subscription in that, whatever business subscription is. I asked simple question that does this data exist? It gave me a proper systematic review that yes, this exists, and I was the happiest person at that time. So, but when I looked at that paper didn't exist at all. And the references it gave within that paper, they didn't exist. Because I asked for the data, it gave me the data. It doesn't mean that exists. So whenever you are using this for your thesis or any work, just make sure to check that. There is a study which says 16 to 60%, up to 60% citations are actually fake using these LLMs. So 6% is still fine, but still problematic. But 60% in a paper, is the whole paper is based on is not the factual paper as such. The problems are risk of hallucinations, then no HUR. It is not just HUR, it is no healthcare integration as such. You don't get the specific answers for your healthcare questions. Regulatory aligned, it is not at all regulatory aligned. If you go to a regulatory body saying that this is done using this system, they will reject that, especially with the generic LLMs. Again, giving some live examples. Has anyone heard about that problem that happened with Deloitte with Australian government very recently? What happened is, and Deloitte undertook a project for Australian government that costed, actually let me give you the cost, 440k USD, basically 4 crore rupees they charge from Australian government to give them a report on what is the benefit or what are the outcomes of their healthcare, or sorry, not healthcare, of their social work or whatever money they are giving to people. What are the benefits? Are the people reaping those benefits or not? They used ChatGPT, provided them the full report, they accepted. Report was written well, they accepted, or student government accepted, but these reports go to the independent people as well, because there are people, professors in different universities, they are part of the committees. So one of the professor noted that this is way good than it should be. So when he looked into the references, and this is a real world example, this has happened now in the last few weeks, he found many fake references. Even in the report, in some cases it was written ChatGPT says, and then the answer. And Deloitte had to return 440K back to Australian government and had to apologize on that. So this is that problematic. Okay, but again, people are using without knowledge up to the level of that extent that this is being used at a government level, this is being used at a best consultancy level as well. Okay, then generalized LLMs. So generalized LLMs are basically, you can have a subscription, you can have APIs for different tools, and you can just hit those APIs directly. So I'll not go deep into that, but this is something very easily possible if you look into the generalized LLMs. But it has the same problem. It requires a customization, but it has the same problem. There are traceability gaps, there are hallucinations. So why can't the most powerful tools know everything, basically for healthcare? Problems are training data limits. We know ChatGPT has and others have the training data limit. They are not trained on the latest data as well. Hallucinations we have discussed. Unverifiable outputs, I have given you example. You get the output, but that's not verifiable. If you look into that journal exists, but that volume, that issue doesn't exist at all. And knowledge cutoff and updates. So you have a different cutoffs. If there is a new study on one topic, but when you are searching when that training happened, it is from the older data. So it is not giving you the best answer possible. Taking an example of it. So training data limit, if you ask a basic question like the overall survival hazard ratio. So hazard ratio is kind of again used to get the knowledge or get the data, which drug is better, A versus B, if we are comparing in a healthcare system. So in a journal training, it is answering a basic, it is giving a basic answer, but this answer is usually generalized. This is not based on any data. It can give you 0.75, 25% better, this percent better, but this usually is not based on the data, factual data as such. Hallucination, I have given you already example of hallucination, and there are different reviews that exist that there are hallucinations in across the data. There is a recent paper as well. It kind of highlighted in one of the studies that this data exists in one of the Cochrane paper. So Cochrane review is for systematic reviews. This is the highest level of highest standard in terms of the reviews. So in that paper didn't exist, but it gave the number as well. Like this is the number of hospitalization there. Then unverifiable outputs, traceability issues, knowledge gaps. So these all problems are there. There are examples as well in this. This is the paper I was talking about. The propagation of AI generated counterfeit citations in scholarship. So this exists, this is happening. There is another paper in Nature as well, which talks about the same data, that in terms of academic publications, in terms of different publications that are coming out, there is increasing number of factual citations that don't exist. What could be the solution for healthcare, particularly if we are building, if we are want to kind of use it for our thesis, for our reports? So what could be the solution? One of the basic answer is RAG. So RAG is retrieval augmented generation. So this is basically like an open book test. So when we have our yearly tests, yearly papers, we study usually in the last few days and then go give the exam based on our memory, right? We are writing some of the facts, some things that are made up, but we are giving that paper. ChatGPT is just like that in a simple language. It is trained on something, but not on the exact thing that is being asked. Building a RAG basically means you have an open book test. You are the same person, you are in the same exam, but now you have a book as well. You just need to refer that book to answer the question. This is as simple as that for building a healthcare infrastructure, building an infrastructure, Gen AI infrastructure to answer the healthcare questions. So, yes. 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 Yeah. You retain your pre-training data, but also now you're asked to just look into this. You can contextualize these answers based on your previous experience. So if you don't have that previous experience, then there will be a problem, because one term can be used in a different way in a paper as well as in the book. So, but if you have that pre-knowledge, then, and also I think in this particular case, one more thing exists. Gemini's, I think there is a BioGemini or something that is more associated with medicine or healthcare systems as such, but that also doesn't give you the good results. We have tested almost everything in this infrastructure system. So what are the issues, or what are the differences between GenAI and GenAI plus RAG? So GenAI is training data, we have the training data limits. RAG delivers accurate insights. You have incomplete or outdated data, you get up-to-date evidence. Hallucinations are problem in GenAI, but with RAG you can minimize. Basically we have seen zero hallucinations with the data. If it doesn't have data, it comes back, tells you that I don't have data for this. There is a scarcity of data. Writes like a medical writer, there is a scarcity of data rather than kind of again writing anything. And then no source traceability. Traceability is there, that's the most important term, traceability. When I was talking about that paper that is given by ChatGPT, we are not able to trace that paper. But if you are able to trace that data from where that data is quoted, then you are sorted. Then this is just like a human process. Human has looked into the paper, has highlighted that this is the data, and is able to quote that paper, that Singh et al. Is the study which reported this data as such. I'll not go deep into that, but just to kind of give you the building blocks of RAG. So RAG is basically you load the data, source files, whether these source files are Excel, PDF, whatever you have, you load that data is processed within that. So again, giving an example, chunking happens there. So chunking basically is your full PDF is converted into small chunks of data, vector data, 0, 1, 0, 1, but in a chunks basis, which are relatives. So if your question relates to that chunk, it will pick up just that chunk, not the full PDF to answer that question. Retrieval, whenever that question is asked, that query is raised, it retrieves relevant chunks and gives you the answer for that. Augmentation, this basically happens because of the training data as well, because of its knowledge as well. There is a question, there is an answer, but it augments, it provides the rationale for that as well, adds more to that, just like a human will add there. And generation, it finally gives back the answer. So this is the full process of RAG, and the data that I'm showing you here, or the process that I'm showing you here, it took us almost 3 years to come to this point. We have been investing heavily in GenAI from the starting, and at every block we have hit the wall. Processing of PDF files, there is a tokenization limit with each and every database. So you cannot process multiple files, you cannot process CSR. CSR is clinical study report, usually that is 1,000 pages clinical trial report. You cannot process with that. We sorted that. Referencing, we sorted that. So this whole process, this whole brain is built in almost 2 to 3 years, in the last 2 to 3 years. And now when you question the RAG, it gives you the answer. It also gives you the reference for that as well, and also the page number, like this is where it is written as such. So just giving you a brief example how the articles are processed in this case. So for example, if a PDF is in this format, this is processed this way. You can see the markdown file from the PDF. So this is how the PDF is converted into the vector database, so 0101 database as such. Excel file, it is converted again into smaller chunks. Images, so images are very interesting. So there are not many databases or not many LLMs that can process images well. So here also in terms of RAG, so we have been using different terms or different LLMs basically. For processing of text from the PDFs, it could be GPT-5 or GPT 5.1. For processing of images, it could be Gemini, it could be Claude. So depending upon what works best, and images are very difficult to read. Here you can see in this image, it has broken down, it has kind of again provided summary of piece by piece for that image, and then that image is converted into the vector database. OCR is a way of doing this as well. OCR, and then the vision is also, I think, one way of doing this. But this is more advanced in a way that this actually saves the context of the relationship between this as well. So in this image, if I tell you, there is a KM curve, Kaplan-Meier curve, what we call, that is used for the survival. So when we read through basic kind of again, either using vision or OCR, it just reads the data and processes it. In this particular case, this saves the relationship as well. The two curves, how they are related. Usually in this curve particularly, you can say the red mark and the blue line, red line. So red line in the first image is having lower survival as compared to blue, and in the next one it is having slightly higher than this one. And there is a median range as well. So median survival is there at when the 50% patients die. There is a median survival in both of them. So it will also save that relationship as well. So when you question that, it can also give you the processed HR from this as well. Great. So these are the building blocks. I'll quickly kind of again touch upon this. When you are building for healthcare, when you are working on a healthcare kind of projects, try to make sure that you are not using a system that is open. If you are using a system that is open, try to kind of again check each and every point. In your commands, you know, prompting is a different, prompt engineering is a different field, but just a small tip that can be, ask your LLM not to give you any false results. Be straight with you. If it doesn't have data, it should tell you that this data doesn't exist. But that usually doesn't happen. Giving you another example from one of the real world example. Many of us, when we are using ChatGPT, so we are also discussing some personal issues with that as well, right? So one example is one of my known a couple. So when they are fighting, the girls goes to ChatGPT and tells the problem like this has happened, and ChatGPT gives the answer, right? So and it favors her every time. So it has a memory as well. It knows how she behaves, how he behaves. So she had a fight with one of her friend as well. So she mentioned the same thing, and it again favored her only. She became doubtful on that, and in the next chat she provided the context from the other side. Similar fights, everything, just provide the context from the other side. It favored the other party. So it is trying to favor you. It is trying to kind of again work on your commands to give you the answers that you're looking for, rather than saying no to you. But you should be careful, specifically when you are with data, when you are with healthcare data, when you are with your theses or your projects that are coming in the future. Okay, so it should have, the system should have authentication, system should have a data governance. So most of the systems are on AWS or the secure server, so data governance is mostly sorted, but still don't use any shady LLMs, or every company is coming up with something like use this ChatGPT or chat tool as such, so don't use that. And try to build the rack pipeline if possible. More than happy if you need any our support, any of our support, I'm more than happy to provide that. And multi-agentic architecture. This is also very interesting thing. So FDA tried a pilot some time back with the drug evaluation. So what happens is, when you are submitting a drug application to FDA or anybody, you submit a dossier to them or your briefing book to them. They evaluate that and they send you some questions, you answer those questions, you answer those queries, and then either your drug is approved or disapproved, or you come back again then if it is rejected. So, and then there are different people that are commenting, that are reviewing that document, 6 or 7 people. If there is an epidemiology section in there, epidemiologist is there who is reviewing. Biostat section, biostatistician is there. Clinical section, clinician is there. They tried the pilot with just one agent. Just like when we are chatting with ChatGPT, there is one agent that is answering our question. Multi-agentic architecture is, we tried to replicate FDA, but in a better way. So we built a multi-agentic architecture. I've presented this last week in Glasgow, when we kind of again showed how a multi-agentic architecture works better than a single agent in these type of systems. In terms of multi-agentic architecture, you can imagine like 6 or 7 experts sitting and evaluating that document at one table. But instead of those persons, there are 6 or 7 agents now One agent has a biostats role, one agent has an epidemiologist role, one agent has a clinical role, and all are giving their opinions on that data particularly, and then that data is compiled and answers are kind of again processed. So this is mimicking the actual human system of evaluation. Then operational deployment is also in itself a kind of again a major area, and how it aligns, what are the guidelines. So one of the problem is the guidelines are lacking, there are very few guidelines. Even some of the bodies, when they talk about guidelines, they call them position statement rather than guideline, so that you cannot catch them afterwards. When you use their kind of again guided approach, you don't come back to them and say that we have used this because you have mentioned this in your document. They call it position statement. We don't have a guidance, we have a position statement, but whatever position statements are, they completely align with the RAG based approach that we should be taking for healthcare. Now quickly jumping on the applications. So from the applications perspective, early drug discovery is one thing where I think sir discussed in detail, but in general, you can expedite particularly identification of molecules, assisted targeting, and also faster hypothesis generation and iteration as well. An example from a recent study, traditional versus using AI and big data. So in terms of the number of years for processing of a molecule, traditional is taking till clinical trials 8 years, and here with using AI and big data, it reduced to 5. But it has potential to reduce to 3 or 2 or 1 as well. Clinical development. First stage of clinical development is when a company starts working on a molecule is looking into the landscape. What exists in that area? Is there any unmet need in that area? What are the different comparators in that area? Protocols, clinical trial designing, CSR development, synthetic data generation. Synthetic data generation is also one of the field that is coming up. How you can, that data doesn't exist, but you have some ideas, you have some idea like this is where a patient's response should exist. Can you generate a full cohort of that? And then risk mitigations. Landscape assessment, this is one of our recent paper with BMS. I'm not sure if you guys have heard about the BMS. It's a major pharmaceutical company. So this paper talks about how you can do a quick landscape assessment. If I can do a quick landscape assessment on any area, you just need to look into the epidemiology, you just need to look into the comparators, FDA websites. So we were hitting the FDA. I discussed about generic LLMs. We use some of the generic LLMs in the RAG system. We were hitting their APIs, getting the data directly, and we were building the full PPTs, full PowerPoints based on very basic information. This is my question, this is my drug, this is the area I want to explore. Systematic reviews. So we all do literature reviews for our thesis. So systematic reviews, it has the major application. GenAI has the major application here. And in this particular case, one is the automated evidence and search triage. So basically you can automate your search strategy. We all develop a search strategy on PubMed or other databases, Embase, if we have the access to Embase as well. Automated screening and extractions. So what we usually do in terms of basic literature reviews is we look into the citations. We have say 10 relevant papers, it's enough for me, I'll write my section. But in generic or in basic systematic review, bias should not be there. We should be including each and every article that exists. That's why screening should happen in a thorough manner. Basically a 2 review and a QC process. 2 review and a QC process basically is 2 reviewers running in parallel reviewing each citation, and QC means when 2 reviewers are running in parallel, they might have conflicts as well. One article, I believe it should be included, this is relevant, but my friend may believe it may not be relevant. So there should be a third person, a QC person, which evaluates that data. And finally, based on that, a full list is developed, and that list is extracted, that data is extracted, and then reporting happen, or we write our sections there, or our papers there. Some of the examples of the automation of SLRs. So Meta SLR is one of the tools that we have been using. This is an in-house built tool, and this is not available for commercial use. We are just using it for our client data or our client projects only. But these are some of the papers with that as well. And this is very proud for us at Pharmacoevidence that we are the first company which has actually done a full automated SLR submission to NICE UK. NICE UK is major HTA body. When I was discussing about Europe, it is JCA, that is the body that is forming. NICE UK is the body which started in 2000s, like again became mature in 2008, and just because of this NICE UK body, I have my job. So HER field exists because of they started asking for health economics data. And this first submission is done with Gilead Life Sciences, Pharmacoevidence and Gilead Life Sciences submitted HTA review process or HTA kind of again for a molecule in PBC, where this SLR was powered by AI, becomes the first SLR powered by SLI accepted by NICE UK or any HTA body in the world. And we had a panel session on this one as well in the last week's Glasgow conference. This is the paper as well published with Gilead Life Sciences, which talks about the first use case of first HTA use case of any systematic review. Meta-analysis, so I'm not sure how many of you meta-analysis, but this is again very sophisticated area in terms of how you are generating the evidence. Say you have done a systematic review, you have 20 papers. 15 papers say one thing, 5 papers say one thing. Qualitatively, we can write that about 15 papers. Majority of the papers mention that aspirin is good for the stroke patients or something else. But can we quantify that? Maybe those 15 papers are actually smaller studies, studies with 10, 15, 20, 50 patients. But the 5 which do not tell the same are the thousands, 2,000, 3,000 patient study, and that is a heavy study, that is the major study. If you can meta-analyze, you have to combine all 20 in one kind of again statistical model, and that statistical model differs depending upon what is your data, what kind of heterogeneity exists. Heterogeneity basically means how different or similar are the studies as such. So you can automate that as well. Your system can highlight there is a difference, there is a heterogeneity, there is no heterogeneity. Multiple types of analysis, Bayesian, frequentistic, then MAIC is one thing where you match the data, particularly using the IPD data from the sponsor, and then AI assisted interpretation as well as writing. Beyond literature, Gen AI has the potential to support particularly the RWDs, the real world data, real world studies as such, claims data processing of EHRs, synthetic arm generation, economic modeling, from model conceptualization till the reporting, you can do everything. And economic modeling in itself is a major area. You have to know stats, you have to know economics, you have to know coding these days, and also you have to know something about the healthcare because you have to mimic the natural human process or the natural process of a disease. Future outlook, particularly when you are looking into the Gen AI based or using the Gen AI in your thesis work or in your kind of future projects, make sure you use the domain specific models. If possible, you look for the hallucinations, you use RAG based workflows whenever possible, you build those systems. Always use hybrid approach. Don't trust on these systems blindly. Human in a loop should always be there. You should be at least checking the data. You should be at least looking into some of the data that does it make sense whatever is written by the system. And then again, transformation of evidence generation from end to end. This basically means that you can actually do now many things with that the possibilities you have, we didn't have at that time. We were looking into the literature, synthesizing some of the papers. Now you have that possibility, you can process hundreds of articles in one go. You can extract, you can rewrite hundreds of articles in one go. This basically gives you the potential to do more. People usually ask me as well that being a global leader for the company, and especially this concern is more with the European front when I am traveling. So from my UK team or from my North America team, that what will happen to our jobs? This is a basic question. So I believe nothing will happen if you are able to upskill yourself. You will be actually earning more, you will be actually working more, and This is what happened with computers as well. When computers came, everybody was, our jobs will be gone. But now the banking you see now is, you couldn't imagine in 60s, 70s, 80s. You have everything on your apps. In the future as well, we may not have phones as such. We may have some sort of interface. We may not have websites. We may have some sort of interface. If I am looking to book tickets, it will create one website for me, link to those tickets, book the tickets, close that website. Anything is possible in future. So just try to upskill yourself. This is an opportunity for you guys that we didn't have. And I can tell you from my experience, you guys or the people who are coming out now in the workforce, they are earning much more than what we were earning. I started my job at I think 5 lakh package as such. Now when people start, they start at 8 to 10 with us particularly, and especially the ones who know this generative AI, every year they need at least 50% increment. I haven't got 50% in the last 12 years as such, but this particular opportunity or this particular time when you guys are here, try to maximize that. You have the potential and you have the sources. Earlier, that opportunity was not there within the India as such. You could say that Bill Gates, all others, they were there. So even Warren Buffett, if you kind of listen to him, he says that I won my ovarian lottery. I was successful when I was born in America. But that's not the case now. You are born anywhere, especially India has now the potential. India has the potential in the next 10 years to transform. Just look into any field, try to transform it, you will be successful. Great. So with that, I'll stop my kind of again session, and I'm very much open to the questions. If you have any now or even afterwards, I'm more than happy to answer. This is my email. If you have any questions, feel free to kind of shoot an email. Thank you.
I have one question.
Yes, sir.
In the meta-analysis, you said, I don't know, I didn't understand much, so sorry for that. But do you have a system where it will search all the databases, for example, Embase and everything, and
Let
then
me show
it
you
will
if I
get
can.
all the papers needed, something like that, and then it will, based on the different statistical models, it will generate the thing and ultimately come up with an hypothesis. Is
Let
that what you're saying?
Yes, yes. Let me show you one quick example of this. I mentioned that I'll be providing a walkthrough, but I forgot. So this is the tool that we have. This is named as Avior. I think they have changed the password. No, this is for our company only, but I think they have kicked me out. No.
It's fine, you can just tell.
Yeah. So in this particular case, I was going to actually show you an interface which is giving you almost everything that you are kind of seeing. Although I don't have all the modules in here, but you are actually able to link to different databases. You are able to extract the citations. You are able to simulate 100,000 picos at once. You may not need 100,000 picos at once, but you are able to simulate that. You are able to extract that data. You are able to analyze that data.
So what I am trying to say is, based on the Prisma guidelines, like we go right now, is we have the initial search, we have X numbers, we excluded these based on this, then we got these, and based on this, then we did, and we come up with final N number that we had for which we use for synthesis, and then we use them for synthesis, and based on that XYZ models, statistical models were used, and ultimately what was the pooled HR or OR, whatever.
Yes, yes, yes.
The
This is
complete process you're saying is has been automated.
has been automated, and this is a tool that has everything. Now I think it's working. So I will not go into deep, and I may not have access to all the modules, but if I show you the SLR studio here, so in this SLR studio, you can see the automation happening. You can either upload the articles, and I am mainly fan of uploading the articles because searching on Embase takes 4 hours for me. Automating with Embase charges me $50,000. So I don't want to kind of again spare like trade of $50,000 with just 4 hours. It doesn't make
There
sense.
are other tricky things like query, because query will be the one which is going to give me the result. So that itself is a
Yeah, So the search strategy basically, and search strategy, after the search strategy you get the articles. Here you can see in the system you have the AI decisions. This article is processed by AI. You have the AI decision, AI saying exclude, include. When I said human in loop, so we are following the guidance from the HTAs as well as Prisma. So Prisma doesn't have explicit guidance on Gen AI, but HTAs have. So they say human in a loop. So you can see a human running in parallel to this, and then human resolving the conflicts for this. And then within that as well, you have a data extraction tool built as such. We call it text tractor. So Ryan is another software, freely available software. So Ryan is a basic tool that is allowing you some sort of kind of data processing and also kind of using the systematic view. It is not using the sophisticated Gen AI, the latest Gen AI tools. I don't think it uses Gen AI. It is a kind of database rather than a processing unit. So this what I am showing you is a full processing unit powered by Gen AI. Just like humans, it runs the full systematic review as such. And within that as well, if I show you some examples for the data extractions, here you can see the study characteristics, ORR. This is one of our recent study of head and neck kind of cancer, where the data is extracted as such. And then there's a yes, yes. That's why I mentioned when I was discussing for figures, we have a separate RAG developed just to kind of again make sure we are processing even we are processing even the KM curves with HRs as well. And within that as well, then you have different kind of again tools. I mentioned modeling as well, but if I show you the writing one as well, so these are the examples for the writings as well. So no, this is proprietary. This is just to give you a sense. This is yeah, it cannot be open, and this is mainly built with the pharma funding as well. So we have been partnering with major pharmaceutical companies in the last 3 years. This has been built, and this is the most sophisticated technology. When I simply mentioned we did the first NICE submission, this companies are trying to do this from last many years. We are a company with very kind of again at a very nascent stage, just 5 years, and we were able to pull off one of the best thing that anybody couldn't do, and the global companies couldn't do. Being an Indian company, having head office and major workforce in India, we were able to pull off that. So this is just because we have been working on this in the last 3 years. And in this case, if I show you one example from the GVD case, so this is again a writing example, how you can write with generative AI. And this gives you the global value dossiers are the value dossiers, or for a product, there is a global document that is developed that goes to all the countries of that company, particularly to support them with their HTA submissions, with their regulatory discussions. So this is the most sophisticated document on a molecule where billions of dollars has been spent. This is actually a write-up for that billions of dollars. And here you can see the system is writing the different sections. There is a prompt here, but there are prompts in the background that are running and asking it to kind of again run the full sections, and it has the potential. When I mentioned the traceability, so here you can see just like when human writes, there is a reference to the article. So in this as well, there is a traceability, there is a reproducibility, it has access to the articles. At the end of each section, you have a list of articles. You can export this into the Word, and this is just like a normal report for you. But this can be 1,000 pages, this can be 500 pages, depending upon company to company. And you can see the figures processed within that as well. So these figures are all developed by Gen AI. No human involvement. Human need to spend a few hours to format some of the tables figures. Otherwise, it is giving you almost everything. Any questions before I conclude? Thank you. Thank you all. Sorry.
Thank you so much, sir, for the inspiring and the futuristic exploration of the generative AI in the healthcare. Your session beautifully highlight how AI is not just assisting in the medical decision, it is also expertise, has added a tremendous value to the today's scientific discourse. So with now, I request Dr. Goyal, Dr. Subhash Agrawal, Dr. Banappa, and Dr. Raman Preet to kindly come forward and join us on a stage to felicitate Mr. Barinder Singh, as we delighted to honor his contribution with a token of appreciation and present him with the certificate. So I request you all to please come on the podium for the certification and the group photograph.
Daman Preet sir. Daman hai, he's Daman.
I called Raman.
Okay. Please join sir. From Masters, Mera Dr. Sangeeta. Okay. So we are really proud of him, sir. A big round for him. He amount to set up data information center in the department also.
You have moved from pharmacology to generative.
Yeah.
Great. Really, the upskilling you were talking about. It's like but that's great.
Thank you so much.
Thank you so much, sir. And I also thank all the dignitaries for their time and presence. So, as session of our pre-conference workshop 2025, it gives me an immense pleasure to welcome our last and the final talk of the today before the live demonstration. This session is a accumulation of the day's enlightening discussion and promises to leave the invaluable insights and inspiration. I request everyone to kindly lend their attention to our next distinguished speaker, Professor Rajesh Goyal, whose work has significantly shaped modern pharmacological science, and it's my privilege to introduce him. Dr. Goyal is a distinguished pharmacologist with over 29 years of a teaching and research experience. He holds the M.Pharm and a PhD in the pharmacology, and he is also a fellow of the Indian Pharmacological Society, member of the National Academy of Sciences. His primary research interest includes neurobiology of the epilepsy comorbidities, pharmacogenomics, computer-aided drug discovery from the medicinal plant, and the network pharmacology. Alongside, he also published over 110 research papers in the reputed journal with overall highest impact factor of 15.11. He has supervised more than 44 postgraduate students, 12 PhD scholars, and successfully completed 11 research projects, including 3 international Indo-Russian collaborations. Dr. Goyal has delivered over 100 invited talks in India and abroad, including USA, Russia, and Canada, and served as a reviewer for the major international journal by Springer, Elsewhere, Ville, and others. He has held a key leadership position, including Dean Faculty of the Medicine and the Dean Faculty of the Pharmaceutical Sciences, Punjabi University, Director, IQAC, and Coordinator, RUSA. He has also served as a President, APTI Punjab, and Executive Member, Indian Pharmacological Society, and is an explained expert in the NAC, AICTE, PCI, and IKG-P2. With these words, I invite Professor Rajesh Goyal to deliver his talk. Please, sir.
thanks for the nice introduction. And on the onset, I'm thankful to the organizing committee and organizing secretary for inviting me to conduct this workshop in Punjab University. And I was just listening to Barinder Singh ji, and I was asking, you are just 20 years junior to me, not more than that. And I feel, I feel a little younger than him. Okay. So when he was talking about AI, I think in India we are not new to AI. Basically AI, what we are interested in predicting. हमारे यहाँ तो जब बच्चा पैदा होता है तो हम कुंडली बना लेते हैं. Okay, so we start with that. Our life starts with Kundli, and that is predicting our life. And see how old AI system we have with us. Now Kundli GPT is there, and a number of other things are available with there. So now, when we are talking about predicting something, the prediction is important. When we can predict, even you are predicting every day in your life, based on your experiences. आज बारिश हो सकती है, कल को गर्मी होगी, जून का महीना है तो ऐसे होता है, दिसंबर में ये होगा. How you are saying this? Because you are having your own experiences, and those experiences are looping in your mind again and again. If you are saying two consecutive things, or you can say two consecutive seasons, you can identify, okay, in this month this will be happening, in this month this will be happening. The same thing now we are doing in the part of computers. I'm little bit different, and I will disagree that we should go more and more on this AI generative tech tools. I have seen a generation where we were remembering the phone numbers of many people, and now even my son may not be remembering my phone number. If he's lost his phone, he will say, oh, how to find it? He may start Googling it and all that, whatever the information is available. So if I ask my son that 59 रुपये दे दो, 59, है ना, तो वो पूछेगा ये 59 क्या है. I'll say कि you calculate this figure with this figure. हम बनिए हैं तो हम तो ऐसे ही हिसाब लगा लेते हैं. तो if you say ask new generation to, you can say calculate, multiply, divide, and all that thing. Generation used to have the tables of 1 and 1/4, 1.5. We were having 1, 2, 3, 4, 5, but they were having that sort of table too. So where we are going? We are going to facilitate our mind to relax more and more with the new tools. So I am not in favor of that. We should make it exercise more. Okay, as he said that generative AI is giving hallucinations. Okay, then they are having unproven or established information. How can we catch that if we are not aware? Okay, so this is not my part of talk, but I am just summarizing what he has said and what is my view on that. But no doubt the new tools are available. Being orthodox, I am also trying that we should get some new tools which can accelerate our process of drug discovery. So today we will be talking about one such topic which attracted me, that is network biology, okay, or network pharmacology. So when I started working on this particular type of things, one of my students is also sitting there. We thought that we cannot get anything out of it because earlier we used to say that finding a new drug is like finding a needle in the haystack. Okay. Now with this process, we are increasing the haystack. Okay. Then we are trying to find methods to reduce that haystack. Okay. So this is another limitation for me. So I thought whether I will get something or not, I don't know. But one thing is that in India, as we talk about system pharmacology, system biology, India is also leading in that concept. India is having the oldest system biology approach to the treatment. If you go to Ayurveda, they have a pulse diagnosis system. And the Vaid will take 3 fingers on one side of this and 3 on the other side of this, and then he can talk about all the 12 systems which are constituting our body, one on this side, one on the other side, just by feeling the pulse. He will not say go for MRI, X-ray करा के लाओ, ये test करवा के लाओ. And I've seen those people who are doing this. They are not asking us कि ये करो, वो करो. They will just diagnose, and then this diagnosis is so, you can say, precise and correct that we even understand that, okay, what he is saying is, I'm feeling within that this is happening in my body. Okay, so that's why I'm saying system biology approach is also our oldest approach. We forgot all those things. Now, when as I told you, the guy is working for UK, I'll say that when the things go abroad and come back to us, then we believe, oh yeah, this is a good technology. But we should not do that. I think we should take care of that what we have in our kitty is also very good. If we are not exercising on that, it will follow. So I'm the same guy as you are. So we started working on network pharmacology. We even knowing that we are very good in the system biology, but still we are working on that. So if you see network pharmacology, if you have to work in network pharmacology, my agenda is today that we should know that what is network pharmacology and how we can exploit it for the drug discovery, and what are the basic concepts, what are the tools required, and what are the steps to be taken for assessing a new target or new drug. We have different domains in this where we can work. So let's start with. So this network pharmacology is a system-based approach. Earlier we used to, if you see the modern pharmacology you've seen, we are talking about drug target. The one target we identify, and then we try to find molecules which are going to hit that target. Now the concept is changed. We want multi-targeted approach, not a single target. Because whenever we are choosing single target, the plethora of side effects were available, which we could not handle. Okay, now we have to see that we have to have multi-targeted approach. Okay, if we are giving NSAIDs, we have to take care of gastric issues also. Okay, if we are using anti-cancer drugs, we have to take care of leukopenia and other things. Okay, so normal cytotoxicity which is available in the anti-cancer drugs, that has to be taken care. So we now need multi-targeted approach, not the single target approach. So that's why network pharmacology is based on system biology or system approach, where we say that nothing is existing in isolation. First we thought that this is existing in isolation. This is not existing in isolation. If we are disturbing one system, it is affecting other system. If we are affecting one organ of a system, it is affecting full system. Okay, so that means we have to be very sure that where we are hitting. And if we are hitting at the right place, we will be able to get the better effects. Otherwise, a lot of side effects will be there. So unlike the traditional one drug, one target model, now we are considering that we should not take off one drug and one target. We should take one drug, maybe multiple targets are there. Okay, then why it matters? Why we should think of it? Why it matters? It matters because it helps in understanding complex diseases, all chronic diseases. You go to any allopathic system, they do not treat it. They use a very beautiful word, manage. And all of you must have gone through that. Management of diabetes, management of hypertension. It's a very fancy word nowadays. Why we are managing? Why we are not treating? In the Indian system of medicine, we were not managing, we were treating. Okay, so now it's very much acceptable to everyone. We are managing the patient well. He is being managed by some pharmacotherapy and some non-pharmacotherapy approaches. That's all. Okay, so this is the end point of modern medicine, where we are not able to take care of the chronic lifestyle diseases, which are ever increasing in epidemiological data, if you see. Okay, this is one point which is missing. It supports drug repurposing. If we talk about network pharmacology approach, it supports repurposing of drugs. New uses of old drugs can be found with this. And during COVID season, you have seen many things have been tried, and it was empirical. It was not, you can say, logical even. ICMR was saying on one day, okay, give what was that, chloroquine. They start with chloroquine. You start with chloroquine, and then after a few days say no, it is not good. You will start with some other drug, then you start with other drug. So that sort of trials were going on to manage that situation. Okay. So that is, some data was you can say again based on some logic for repurposing of those medicines for that COVID. Otherwise, that was not logical. So, but network pharmacology helps in that. Traditional pharmacology, I think we have discussed this. We can skip it also. It focuses on single drug, single target, and now if you have, there are medicinal chemists available among us, I think they will find that they were having such a serious issue that they were taking QSAR such seriously that okay, this drug should bind to this receptor only, and they should have maximum binding, maximum efficacy. Okay. So suddenly there was an approach that if 10 molecules are there, and these 10 molecules are binding to one receptor, and out of that compound 1 to 2 they are having best binding, but they are having side effects too. Okay, more side effects are too. So the selection of molecule then started slowly to a molecule which is having less binding affinity and less efficacy, but no side effect. Okay, this sort of selection was going on. So slowly we started with that, and now we are having multi-target approach with reduced side effects. So it aids in polypharmacology, one drug, multiple targets, all those things are with the network pharmacology possible. So these are the key concepts in network pharmacology. If you have to go for you can say network pharmacology approach, what you need? First is biological networks. We should have understanding of different biological networks. Then we should have a knowledge on how one system is integrating with the other system, how it is supporting, how it is antagonizing its function, how it is regulating its function. That is important. So that's why we say in pharmacy that if you are not studying physiology properly, then don't expect that you will be a good pharmacologist. So you have to go through physiology. You have to understand how the body normally functions. Then only we can find out the abnormal functioning, or we can address that. Then polypharmacology is another one. Now in the system biology, nowadays we are having integration of genomics, metabolomics, proteomics, and all those things. Okay. Now what are these omics? Omics are now big databases, the big data driven or approaches are there. Then one drug, one acting on multiple targets, that is the last one, polypharmacology, is to improve efficacy and reduce resistance. Anti-cancer drugs are most probably finding in this category, and then we have antibiotics too, which are also finding in their place in this. Antidepressants affecting both serotonin and norepinephrine pathways, for example, is there. Earlier we were saying no, we should have either TCADs or we should have either SSRIs. Now say no, let's combine both of them, and that will be giving better effect at a lower dose and with less number of side effects. So this is all the things that happen. So when you have to exercise network pharmacology approach for drug discovery, these are some steps which you have to take care. One is first is data collection. You have to search different databases. As I told you, predictions are not possible without experiences or with set of databases. So we have to have databases, and then how to you say search those databases, then we have to have some algorithms for that. So algorithms, databases, that will ultimately lead to good predictions, okay, or good, you can say, churning of the data. So in first data collection, we can have drug target based databases, like drug, we have to find drug targets. So drug bank, Campbell, and then we are having PubChem. Disease, gene association, OMIM, DisGeNet, and there are another things. So my student will be explaining different resources to you in this lecture only. Protein interactions, we have to understand how the protein is interacting with the other protein, because we know that in our biological networks we are having connection through different proteins to reach to the effector organ, or to the final effect we have to get. The network construction, we have to understand how the network is constructed. Genes, they are acting as nodes, and the connections, they are acting as edges. So, nodes and edges, how they are, you can say visualized, that is also based on cytoscape, string and stitch. They are involved in synthesis as well as visualization of these networks. Then computation analysis. Computation analysis, for example, I am saying that all of you are genes here, and let's say she is sitting near to him. So, she is connected to him topologically, but she may not be even knowing functionally. Okay. So, this is the difference, topological and physiological interactions, that is it. So, you can have network topology identifies hubs and bottlenecks, then we have clustering and pathway enrichment, and in which pathway these genes are more, you can say working more in that sense. Then we are having machine learning and AI, which will predict again out of that cluster which one is better. Now, scope of network pharmacology, drug repurposing, multi-target drug discovery, disease mechanism studies, how diseases you can say developing, and then we can work on that, how we can take care of it. Then precision medicine, which is now a buzzword that everyone is after it, that we should go for precision medicine, we should increase the personalized care of the patients. So, now coming to the very basic thing, and the biological systems, they are represented through networks. One protein is interacting with other is interacting with the third with fourth, and this is not linear, this is a web-like situation. This is not linear, this is like, so for our understanding we go for that linear explanation, but it is web-like situation. So, essentially every biological entity has interaction with other biological entity. One entity is there, it will be interacting with the others. And then different type of networks, biological networks are there, ecological, neurological, metabolic, molecular interaction networks, all are available there. The system biology aims to understand biological entities at the systemic level. Okay, at this system is working, how they are interacting with each other, and how the system works based on that, with those networks. So, analyzing them not only as individual component, but also as interacting systems, that is important. Then related to network biology approach, which allows the representation and analysis of biological systems derived from graph theory. Now, this was the place where we started to understand that what are the networks. So, this is owing to the graph theory. So, this is a little history of graph theory. So, a Swiss mathematician Leonhard Euler, he applied this theory to connect 7 bridges of an island. Okay. He wanted to see that one should visit all the islands using minimum number of bridges, or maybe all bridges, but he should know how to go through it, how to construct those bridges. So, no one had ever found a path that visited all 4 islands and crossed each of the 7 bridges only once. Okay. So, Euler solved that. To solve the problem, only the relations between the land masses are irrelevant. You cannot have the relation between land masses and not the shape or actual distances on the maps. So, he represented it like this. So, in this case, if you find there are different bridges which are connecting all land masses of that country, but he represented it in the form of the final form. You see at the end of it, that form is so, the last one, if you see, there are 4 land masses and they are connected through different routes, edges, they are called edges. So, now he represented the land masses as nodes and the ways to connect as edges. So, this is how we started with the graphical representation of interactions. So, network can represent many different type of data, not only biological network, metabolic network, any other data also is presented. So, here nodes represent different entities. proteins, genes we are interested in, but there can be other things like land masses. In this case, they have used. Edges represent links between the nodes. Okay. So, depending on the nature of underlying edge information, different type of analysis can be performed. So, these are the main type of networks which we can design. The first one is undirected edges. Here we are not giving any direction. We are saying that X is connected to Y is connected to Z, and it is connected to A, but we do not know whether A is affected or Z is affected. We do not have any direction, but they are interacting. There is some interaction between that, but it is not clear that what is the nature of interaction. Okay, so that is not there. So, this type of edge is found in protein-protein interaction networks when we are making PPINs. So, we are having these type of networks. Then coming to second type, directed edges. All of you must have gone through biochemical pathway where the metabolism is shown, and then we are having directions from A to B, B to C, and C is going to be affected by D and all that. So, this is a directional network. Now, here we know the process is interaction is going from up to down or down to upside. So, hierarchy is there. Then weighted edges. In last two examples, we do not know the strength of interaction, either it is directed or it is undirected. We do not know the strength of interaction. Now, here what we can do, we can put the strength also by increasing or decreasing the lines, thickness, interacting edge. Edge thickness will tell us it is having strong interaction or it is having a poor interaction. So, here you can see the example. In example, you will see that somewhere it is written 16, somewhere it is written 12, and somewhere it is written 4 or 8. Now, you can see the significant difference in the thickness of the edge, which is connecting those two nodes. Sorry, graph theory, if you see network topology, mein, graphs have some properties that are very useful when unraveling the information that they contain. Okay. Now, what are the different type of information we can get from that? So, it is important to realize that the purpose of any type of network analysis is to work with the complexity of the network to extract meaningful information. हमने एक network बनाया, we made a network of different proteins. What do we want out of it? What is the aim? What is the aim? To understand that which proteins they are upregulated, they are downregulated, or they are interacting during a process. And what is the quantum of interaction? What are the parallel ways that they can interact, or it is the only way they can interact? Okay, so all this information can be extracted from the graphs. So these are some properties. Like first property is degree. Degree is the number of edges that connect to a node. Number of edges that connect to a node. In socially also we say that this person is very important. Dr. Anil is very important today. Why he is important? Because all spokes is arising from him. Transportation में कौन है, accommodation में कौन है, registration में कौन है. So we have to see that that fellow is very important. If we have to see accommodation or pre-conference workshop, I have to ask Dr. Nilima, अब किसका lecture है, अब कहाँ होगा, किधर होगा. So she knows it. So that means, so we are having main hubs, then side hubs. So these hubs are based on the degree to how many different proteins they are connected to. More they are connected, more important they are. Okay, as you can see here, the figure says 5, 3, 2, 1. So that means if that protein is connected to 5 other proteins, we are giving degree 5. If it is connected to 3, we are giving 3. So depending on that, you can have a degree of each protein in that network. Then second thing what we find is shortest paths. As we have seen in the metabolism or in the cell signaling, we are trying to see if cell signaling is there. For example, drug is binding to some receptor, how it is giving the final effect. This way it is going, this way it is going, or this way it is going. So we have to find best shortest path. So, in topology you can find that this will be connecting to this and this will be going to this, and then we can have the shortest path. This is another thing which is important to understand, that if you see in the figure, we are having 4 intermediate proteins which are showing the effect is surpassed from A to B, and if we go by other ways we can increase the number, but we want shortest path. So, that is important. Then scale free networks. So, in scale free networks, what we are finding? We do not have a specified scale. Okay. So, most of the nodes are connected to a low number of neighbors, and there are small number of high degree nodes, okay, that provide high connectivity to the network. आप देखेंगे छोटे छोटे क्लस्टर बने हुए हैं, है ना, बाकी पूरे नेटवर्क में आपको दिखेगा कि एक तो यहाँ है, फिर एक पास यहाँ है, उसके आसपास क्लस्टर बहुत अच्छा है, इसके आसपास क्लस्टर बहुत अच्छा है, बट इट इज़ नॉट ऑन द whole, it is connected well. ठीक है. So, then hubs are highlighted based on that clustering. What are different hubs? The hubs are called important proteins of that network, as we have seen in that. Then transitivity, it relates to the presence of tightly interconnected nodes. So, we can find special type of nodes or special clusters which we can based on transitivity. Then centralities. Different type of centralities are important, because if you go to Cytoscape or other tools, they will you can say differentiate the nodes based on the centrality parameters. Okay. Between centrality is there, then we can have centrality is basically measured for nodes and for the edges and given an estimation how important that node is. As I told you, 5 degree for freedom is having better centrality in that. So, this is how I will just give a glimpse. This is how they are calculated. If you see the mathematical way, 0, 1, and then we can have more scores on that. You can see a network with undirected, unweighted edges will be represented by symmetric matrix 0 or 1. Okay, if you see the first one, you will say A, B, C, D, E, F, G is there, and A, B, C, D, E, F, G is in the vertical column. So, based on the distance to that, we are finding 0, 1, 1, 1 to each other. So, 0 means the same, and 1 means next to it or adjacent to it. So, this is adjacency matrices. So, based on that, you can find the degrees. So, for example, if you see A is having how much degree? 5. If you sum first row, you can say first row of that figure, 1 plus 1 plus 1 plus 1, it becomes 5. The other one, it becomes 2. So, this is how it is calculated mathematically. So, as I told you, there are different type of biological networks. So, they will be regulatory networks, they can be metabolic networks, they can be protein-protein interaction networks. So, if you see this one, you will find that there are proteins, there are metabolites, and then the metabolism is taking place, then there is gene regulation. So, some regulatory pathways also playing in that can also be depicted in the networks, and it can also be calculated based on its impact on the network process. Some of the most common type of biological networks are protein-protein interaction networks, metabolic networks, genetic interaction networks, then we have gene transcriptional regulatory networks, cell signaling networks, which we usually study for the drug discovery. So, next part I will ask my student to take care. I think she will be talking about, I think this is same, we are repeating most of the things. So, I thought we will be using same information in the workshop time too. So, I am not taking much time on it. So, clustering analysis is there. As I told you, we are finding some clusters which are closely connected proteins in that whole network. So, they are usually representing the pathways, different pathways which are involved in those processes. So, module is there, cluster is there. So, these are different names given to tightly connected part of the network. motifs are also the similar things. We will be discussing that in the workshop, I think. So now the second part is what are the different databases and web services which are available, and that will be taken care by Ms. Arvinder. Should I move this?
Okay. A very good afternoon, all of you. Can you give a big round of applause, please? Thank you. Thank you so much. Yeah, this is for my guide also. And I also want you to be charged because I think you are so much low. Okay, so we'll have a quick review about what are the different databases and web services which are present. Sir has already taught you about the network, their properties, their topologies, and you also come to know about the different steps which are including under the network pharmacology. Okay, so first step, if you have already read that, that is called the collection of a data. Okay, and then you need to construct the network, and after that you need to analyze your network, and you need to extract out some meaningful information from the bigger data sets to have a minimum network, and then you need to also come to about the molecular functions, their annotations. Okay, so for that we having a different databases and web services. These tools can be free and they can be need a subscription for that. Okay, so first you can I'm going to give you a quick review. You just note down the database's name, and we'll have that in our workshop at the time after lunch. Okay, so first we having a genomic data collection. This include the DisDNet. This is a widely used database and tool. It contains the information about the relationship between human and animal genes and disease that was accumulated from the various sources, mainly through the text mining approaches, as because you are not able to read a longer text from the papers or the publication to collect genes for a single disease or a single plant later. So you can easily get the number of genes within I think 1 minute, less than 1 minute, by putting just a disease name or a plant name. Okay. Then next we having an NCBI gene. They offers detailed information on the molecular biology and the genetic of human genes, including gene sequence, variations, and functional data. Next we having a gene card. This is a database that provide information on human genes, including their functions, their pathway, disease, and expression profiles. Next we having a gene mania. This is a tool for gene in function prediction and gene interaction analysis based on a variety of data sources. This database specifically includes so many gene related information from the different sources too. Okay, then we having an ensemble. Ensemble provide the genome sequence, gene annotation, and other genomic data for various species too. Then we having a gen code. Gen code is a comprehensive annotation of the human genome, focusing on genes and their expression. Next, we having a GWAS catalog, that is called Genome Wide Association Studies. They provide data from a large scale genetic studies to identify the correlation between the genetic variants and the disease. Next, we having a UCSC genome browser. This provide a graphical interface to explore the genomic data across multiple species, including the gene annotation, variation, and other functional data. This is the genomic data, some of the genomic data collection databases. Next, we having a plant data collection, that from where you can collect the plant data. The first of all and most widely used nowadays, that is called traditional Chinese medicine system pharmacological database. This is a database that provides information on the pharmacological properties, chemical compounds, and therapeutic targets of the traditional Chinese medicines. Okay, but you cannot rely on the Chinese medicine, but you also need to know about the Indian constituents. So this is the next database, that is called Indian medicinal plant phytochemistry and therapeutics. So this is a manually curated databases. This include the data from around 7,000 publications and 100 books. which are related with the Indian plant medicinals and all properties. Okay, so from that you can collect the databases regarding the Indian plant, their phytochemicals and therapeutic effects. Next, we having a phytochemical interaction DB. This database that catalogs the interaction between the phytochemicals and proteins that helping to link the plant-based compound with their potential therapeutic effects. Next, we having a Ayush research portal, and we having a Dr. Duke phytochemicals and ethnobotanical databases. They also include the information regarding the Unani, Siddha, homeopathic, all the medicinal plants and their things with that. And then you can also see about the chemical, biological and other functional properties too. Next, we having a Batman TCM. This is again the traditional Chinese medicine. This provide the traditional Chinese medicine with their potential therapeutic targets as a network based analysis. Then we having an Array Express. This is a database of functional genomics experiments focusing on gene expression and other high throughput genomic databases. Then we having a gene scan. This is a tool for detecting a gene structure in genome sequence, helping to identify coding regions, exons and introns in the DNA sequence. Next, for example, you have already collected your data. You have collected the data regarding the genes, and you have already collected the data regarding your any phytochemical or phytomolecules. Now you need to construct the network. Okay, so for construction of the network, we are having first database that is called BioSys. This provides the pathway and genome data for metabolic pathway enzymes, their interactions and across various organisms. I think you are all aware that what actually the network contains. It contains the interactions of your genes, right? And then you need to further identify or analyze that network. So for that, this include the interactions of across various organisms. Okay. Then we are having a MINT and INTECT. This is a repository of molecular interaction data that offering insights into protein-protein interactions, both experimentally validated and computationally predicted databases. Then we having a Signor. Signor is a signaling network open resource. This database is freely available resource that include the graphical representation of directed interaction between the protein. You know the directed interactions, right? Then we have a String. String is also a widely used database for constructing the network of the proteins. So this is a database that provides information on known and predicted protein-protein interactions, helping researchers understand cellular level and network biological processes. Next, we are having a Cytoscape. This platform is used for visualizing and analyzing molecular interactions, network, their pathways, and the biological networks too. Then we are having a similar expression analysis, a tool for comparing gene expression profiles across different tissues or conditions that helping to identify genes with similar expression patterns. Then we are having a Metascape. This is an integrated platform for performing gene functional enrichment analysis, protein-protein interaction network analysis, and pathway enrichment. We are having a Gene Mania. Gene Mania is a tool to predict the gene functions, interactions, allowing researchers to explore the gene networks and biological processes. We are having a Swiss target prediction. This predicts the potential targets for small molecule based on similarity search with the known protein ligand interactions. Okay, next step we are having a gene enrichment. For example, you have collected your data, right? You have already constructed the network, but now you are having a bigger network with you. You need to extract some meaningful information for you. Okay, for that this step is called gene enrichment. Okay, now you need to analyze your network. You need to make so many filters to exclude out the other things which are not of your interest and coming out to your functional approaches. Okay, for that we are having a gene enrichment tool, and the most widely used that is called a DAVID. The database for annotation, visualization and integrated discovery is a web service with tools for functional annotation of genes, including the gene set enrichment analysis. Next we having a drug bank and databases. You can just put your gene name over there, and then going to give you the whole information about your genes, their interaction with the drug, their functional annotations, like they are including in which pathway, which biological process, and which metabolism they have been included in that. Okay. Then you're having a therapeutic target database. This is a comprehensive database for therapeutic targets, including information on drug target interactions and relevant biological pathways. Then we having a pharmacogenomic knowledge base. This is a resource for understanding how genetic variations affect individual response to drugs, providing information on drug labels, variants and pathways. Next we having a KEG that is called Kaito Encyclopedia of Genes and Genomes, is a freely available. This tool is within the DAVID. You can also find out there. Okay, so they are going to give you the information on more than 100 and 300 signaling and metabolic pathways that have been linked with your gene sets. Then we having a gene ontology. This is a knowledge base of gene functions, which consist of 3 ontologies. They include the biological functions.
That's what I was expecting them कि that they should focus on this. Yes sir. आपका इसको recording करने का है? दोनों हो रहा है ना पहले? हाँ. YouTube पे definitely she would be there and आपको होएगी. But maybe even
people can see it afterwards.
yes, yes. They should focus on the listening. मतलब हाँ. दोनों है. Okay, that's best part.
Okay.
All the lectures would be going live presently live telecast हो रहा है and कल का जैसे 6 lectures आ गए अब YouTube का link आपको share हो जाएगा you can experience.
You can review it. ऐसा नहीं कि अभी एक बार हो जाए तो खत्म हो जाए.
हाँ. That's the best. Continue.
Thank you, ma'am. So we are having a gene ontology. They include 3 ontologies, such as they have been giving information regarding biological processes which are related with your gene set of networks, and then we are having a molecular function as well as cellular components. Then we are having a Panther. Panther is a tool for functional classification and pathway analysis of genes, offering insights into gene families, evolutionary history, and biological processes. We are having a Bingo. It's a Cytoscape plugin. Within the Cytoscape, you can find the Bingo plugin over that. They are going to help you to analyze and to enrich the system of a biological network to identify the overrepresented function in a gene sets. Then we having a gene set enrichment analysis. This is an analytical method to determine whether a predefined set of genes show statistical significant differences in expression between 2 biological states. We are having a gene ID. They provide identification and details for genes including functional annotation, expression, and interaction across multiple species. We are having a cluster profiler. This is an R package. For running this, you need to learn the R coding within you. Okay, so this is an R package for statistical analysis and visualization of functional profiles for gene cluster, including enrichment of gene ontology terms and pathways. We are having an enricher. Next, we are having an enricher. This is a tool for performing the gene set enrichment analysis and visualizing results with various biological annotations. We are having a Rectome. This is a curated database of biological pathways, providing detailed information on molecular pathways, gene regulation, and cellular processes. We are having a Galaxy. This is an open source platform for performing complex bioinformatic analysis, providing tools for data analysis, visualization, and workflows. We are having a BLAST, that is called Basic Local Alignment Search Tool. They are widely used algorithm for comparing the nucleotide of or protein sequence to database and identifying the regions of similarities within your gene sets data sets. Thank you very much. You can ask any question, not to me, but yes to sir. Thank you.
Definitely sir, definitely.
So in this talk, I think we have talked about 2 things. One is what is basics of network. Second is what are the resources where from we can get the data. Because we need to extract the data and then analyze the data. So she has explained different tools. The choice of tools will be depending on your own choice and your own common sense. So we cannot say that this tool is better, that tool is bad. But some of the tools, they are having data which is manipulated. Some are having predicted data also. So predicted data is not that you can say reliable. So we have to understand that which tool is or which you can say database is better for us. So then again, the questions are, you can ask any question if you want now, or if you want to interact during workshop, then again that is also possible. Because lunch time is there, so I want to stop you. But
Definitely, Sunali is going to give a formal thank you and with her words. But मैं अपना journey मेरा अपना experience है गोयल सर के साथ because I think I'm junior and student of yours. So like बहुत अच्छा लगता है when you see your own colleagues and your teachers come back to the department. हमारी जर्नी रही है.
It's homecoming for me.
Yes, basically. हाँ सर का अपना डिपार्टमेंट है and we always look forward to come and जितनी बार सुन ले उतनी बार कम लगता है सब लोग. So thank you sir so much for sharing your knowledge and जो सबसे बड़ा मुझे प्यारा पार्ट लगा है that is student teacher bond आप लोगों का. The regard she expressed for you and the platform you have given to her. That's the best part of yours. Thank you.
So with this, I'll say thank you to sir and also to the team for their intellectual rich talk and the way they connect the biology and the system science and the computational reflects the true spirit of the modern pharmacological innovation. And your insight have been greatly enhanced the scientific depth of our workshop. And with this, we are here to felicitate Dr. Goel, and I request Dr. Banappa, Dr. Damanpreet, Dr. Subhash Goel, and Dr. Nilima Dhingra to please come on the podium to felicitate Sir as we present him with a certificate and a token of the appreciation. And I also request the team member of Goel Sir to join.
At least sir के लिए proud moment होती है बेटे. I think this is the best one for any teacher.
Yeah.
That's the actual reward for any teacher when the students doing better than teachers are. So जब मेरे बच्चे भी यहाँ पे खड़े हुए हैं तो मेरे भी कॉलर्स आप होते हैं.
ये सारे स्टूडेंट
हाँ? हाँ मुझे पता है. मुझे पता है. मुझे पता है. मैं तो आजा बेटा. Please आइए sir आइए. So I said come this way.
come here.
Come बेटा.
This is for her also.
Yes, definitely. आजो आजो बेटा. Sir, please. Sure. Thank you, sir. Thank you, sir. Yes. आइए, sir. Sir, please. Thank you so much.
I feel she should also get a certificate.
Definitely, we will provide.
So,
Lunch is, please make the announcement.
so now we invite all the participants to proceed for the lunch, and the lunch will be served near the ICSR hall. So we are sincerely thank all the dignitaries and participants to join the morning session and for the patience and their active engagement. Please be seated. Let the dignitaries first move forward for the lunch, and then I'll request all the participants to go without hurry. And I also ask volunteers to please help all the participants to reach the dining hall for the lunch. And after the lunch, you all have to just assemble here for the live demonstration, and kindly bring your laptops for the live demonstration as we are not providing the laptops to everybody. So be here by 2 p.m. sharp because we will start the live demonstration by 2 p.m. Okay? And if anybody have any issues, they can ask the volunteers. Okay? So kindly please bring the laptops and stay in this place because we are not providing any laptops. And if you can connect your internet, it will be visible for you, and if there is any problem in connection, we will provide some of the IDs and the passcode for the connection, internet connection. I hope you have a refreshing lunch. And now we will start our live demonstration session for the computation and network pharmacology and the. So before we begin with our first practical session that will be bring together by two experts, that is Dr. Rajesh Goyal and Dr. Sandeep Kumar. Before we move forward, I like to give a brief introduction to Dr. Sandeep Kumar. Dr. Sandeep Kumar is presently working as an assistant professor at Chitkara College of Pharmacy, Chitkara University, Punjab, India. He has been actively engaged in neuropharmacology and network pharmacology-based drug discovery with a special focus on drug-resistant epilepsy. He has made significant contribution to an ICMR-funded project serving as a senior research fellow and to an Indo-Russian joint research project funded by the Department of Science and Technology and the Russian Foundation of the Basic Research, Russia, where he worked as a junior research fellow. He completed his PhD in pharmacology under the kind supervision of Professor R.K. Goyal at Punjabi University, Patiala, India. Dr. Kumar has published more than 10 research papers in reputed international journals, including scientific reports. He has been recipient of the prestigious travel grant from ICMR, CSIR, IBRO, and has presented his research at international conference in India, Russia, and USA. So with this, I invite Dr. Sandeep and also Dr. Rajesh Goyal to please head on the session. Please, sir.
So I hope net is working with you all.
So again, coming to the podium for hands-on training, which will be entirely conducted by Sandeep. I'm just introducing that we can have application of network pharmacology for different purposes. In our lab, we are having it for target fishing, finding new targets, and then for finding the mechanism of action of different plants. Okay, and the virtual reverse pharmacology we are carrying out based on that. And then we are also used, we are pioneering that, nobody has used it yet. We have used this approach for developing animal model for drug-resistant epilepsy. Okay. So today I think the paucity of time is there, so we will be able to conduct the workshop only for for finding new targets based on network pharmacology approach. Just an introduction for 5 minutes, then we will be continuing. If you see drug discovery, discovering new molecules is an ever, you can say, untiring process. In pharmaceutical, you can say, escape that we are finding new molecules again and again with better efficacy and toxicity profile should be low. And for that, we have to have two informations with us. One is whether we should know the structure of drug, who is already acting in that way, or we should know the structure of target where it is acting. Okay, there are two types of drugs which are there. One we say as Me Too type of drugs, and most of the medicinal chemists they are making Me Too type of drug. Once we had the idea of receptor, the receptor pharmacology was there, and based on that we started working on that. This is the receptor, and this is the molecule which we can fit on that receptor. So this concept is known to all of you, I think, lock and key concept, where we say okay, lock is the receptor and key is the drug. And as a medicinal chemist, most of the molecules which was inside, because there is the era of chemistry, we say era of biology and era of now information technology nowadays. So at that era of chemistry, most of the chemists were engaged in synthesizing molecules which should best fit into the structure of known receptors. And in that case, if you see phenytoin, mephytoin and all those, so the name of drugs you will find are similar, they are having similar structure also. Okay. So they are called Me Too type of drugs because they are having some similarity with the earlier drug, and most of the time some side effects, some other issues are also same as of the previous drug. So this is how I used to say, give an example that how the medicinal chemists used to act. They use like a locksmith. चोर चाबी बनाते हैं, एक ताला पता चल गया, उसकी चाबियां बनाएंगे नहीं बनाएंगे. So this is how we are doing it. We are making duplicate keys which are fitting into the lock, and this finity of that. We can have infinite number of molecules. We have to stop thinking at some place. Okay, now we can't have more molecules to fit in this particular structure. So limited success was there, finity of synthetic molecular diversity is there, and left many receptors orphaned. This approach, particularly chemistry approach, this left many receptor orphaned to some diseases. We were not searching for new receptors. Okay, we were working on the existing receptors and trying to make more and more molecules, because it was very good for pharmaceutical industry too, because it's cheaper than this. And then these were called me too type of class drugs. But now the pharmaceutical industry is shifting. They are saying that we want first in class drugs. Now they don't want to go for me too type of drugs. They want first in class drugs. For the first in class drugs, they have to be first to discover the drug, but for that they should know new targets. Okay. So with this background, I'll say that how this approach will be useful to find new targets. I'll give over to Dr. Sandeep.
Thank you, sir, for clarifying for background on network pharmacology. Now it's time to explain Python session on network pharmacology. So the objective of our session is to identify a novel drug target for a multifactorial disease. So this is the simple workflow of drug discovery process, whereby we start with selection of any disease of interest, and then we select a specific disease target, and then we select specific drug-like molecule, and then we go for validation in animal model, and then finally clinical trial. But the main issue is, if a disease is multifactorial means maybe 400 or 500 proteins are specifically connected to onset or pathogenesis of any given disease. Then the question is how to select one, and on what basis we can ignore remaining 400 or 500 proteins. So this is the main question. Normally, how we identify as a pharmacologist, how we identify a drug target for a complex disease. Regular approach is we just go for extensive literature review, and then based on our expert pharmacological opinion, we select one. But it is time consuming and require thousands of animals. So we are searching for some alternative. So here network pharmacology is a good alternative, whereby we create a protein-protein interaction network of all the protein associated to any given disease. And then we understand how these proteins as a group working together and responsible for onset or progression of disease, and out of that we select some group of proteins that work together and contribute to progression of disease. And finally, we identify or we prioritize most influential protein that is central to different group of proteins that are working together. So this is our ultimate goal of this hands-on session. We will identify a disease target for a complex disease like epilepsy. You may try with any disease of your choice with the help of network pharmacology, using some freely available or open source databases, websites, softwares and algorithms by following 7 simple steps. So this is the workflow. In step 1, we will identify or we will find the licensed drug for disease of our choice. And then in step 2, we will identify molecular target of individual drug. Our objective for step 1 and step 2 is to clearly identify the therapeutic space, means licensed drugs are working only on these targets. And then in step 3, we will identify the disease space, like which proteins are mainly involved in progression or pathogenesis of disease. So in step 4, we will compare the disease space and therapeutic space to check on which disease space the existing drugs are mainly hitting and which space is still open from which we can specifically identify the novel targets, right? So step 4 is very important to discover what is the open or available space from where we can identify the novel target. So this is a very important step. And then in step 5, we will create protein-protein interaction network of novel targets, means targets that are still not occupied by the licensed drugs. And then in step 6, we will perform the enrichment analysis, by which we will check in which molecular pathway, in which biological process, or in which tissues these proteins are mainly expressed. And then in step 7, we will identify some disease modules. Disease modules means how some group of proteins are working together and contributing to disease. And finally, we will identify the most influential gene, that is the central hub, that is connected to this group, and this group. So this is our end goal. So is it clear, our workflow? So I am giving hands-on session on epilepsy. You can try it on any disease of your choice, right? So step 1 is identification of licensed drug. For that, you have to follow these steps. You have to open your browser, go to Drug Central, and then type disease of your interest, and then you will copy the name of licensed drug and paste it into your Excel sheet, right? So I'm giving you around 4 to 5 minutes. You just follow. Let me demonstrate it online also. So open your browser and go to Drug Central org. Now click to search box and type epilepsy. So now I see list of approved anti-epileptic drugs in which carbamazepine is listed on top. So now I have to copy the name of this drug and paste it into one Excel sheet. So I request everyone of you to please copy name of at least 10. Just copy the name. Our objective is to identify licensed drug for treatment of specific disease of interest. So first drug for epilepsy is carbamazepine. So just copy the name and paste it into your Excel sheets. At least, we need at least 10 drugs. Like these drugs are basically licensed to use in epilepsy, means these are approved in USA, India or Europe. So these are the basically approved drugs. For the practical demonstration, we are just copying the only 10. We are performing our analysis with 10 drugs, right? Our objective is to identify the therapeutic space. For that, we identify all the licensed drug, and then we identify molecular target of individual drug. So that, after that, we can only able to say that this is the therapeutic space, like licensed drugs or pharmaceutical industry is mainly hitting on these targets. And then we will compare that with disease space to check which space is occupied and which space is still empty, from where we can identify some novel target, right? So I hope step 1 is completed. Now we are moving to step 2, that is At least name of 10 drugs. On which disease you are working on? Epilepsy, okay.
If you diabetes, anything you want to do?
Anything you want to, in which area you want to work.
Or they can have later on with
हाँ, presently क्या होता है वो flow में चलते हैं ना, increasing for example.
Let me know when you are ready with name of 10 drugs. So now let's move to step 2. Step 2 is identification of molecular target of individual drug. For that we have to open another website, that is drug bank, and in this website we will paste the name of first drug, and then we will copy or identify molecular target of carbamazepine, and again then we create another list, right? So let me open my browser. Go to drug bank. Now search for the first drug, that is.
Sandeep, you have to reduce, I think.
So which one? Okay.
Senior also, you have to reduce.
For step 2, we are going to drug bank and then typing name of our first drug, that is carbamazepine. So now we are onto the carbamazepine page, and from here we have to select the targets. So this is the first target of carbamazepine, that is voltage gated sodium channel alpha unit. Scrolling down, this is the second target, that is neuronal acetylcholine receptor subunit alpha 4. This is the third target, nuclear receptor subfamily 1 group member 1. So these are 3 targets of carbamazepine. Now we have to copy the name of gene from here and paste in front of carbamazepine like this. This is the first target. This is the gene name for second target. This is the gene name for third target. So now I have to complete this process for entire 10 drugs, right? So we have 10 minutes. Complete this task within.
Gene name, just gene name का लग रहा है.
You want to go back to that step?
Okay. Let me show you again. First, you have to go to drug bank, right? Now in search bar, type first drug, that is carbamazepine. Now you have to go to this target section, right? Is it clear? So now you are on the target page. From here you have to copy the name of gene, right? Is it clear?
Right lower corner, you will find gene name. You can copy.
Yeah, but these are the molecular target of specification. So we have to collect the all the molecular target of individual drugs, and we have to repeat this process for at least 42 or 50 drugs. Like from 1912 up to now, around 42 drugs have been licensed to use in epilepsy. So first we have to identify those drugs, and then we have to identify molecular target of individual drugs. Yes. So that is what we are looking for. Yes, yes. We have to complete entire list of therapeutic target related to epilepsy that are mainly used by existing anti-seizure drugs, right? Similarly, for second, that is second drug is phenytoin. Now go to target. So these are the targets of phenytoin. That is sodium channel. Second is another subunit. Third is voltage gated channel. Fourth is L-type calcium channel. Next is sodium channel. Next is sodium channel alpha. So you have to copy the name, these names, and paste it in front of individual drug, like here, like this. Like this is basically ion channels, and ion channels is basically made up of polypeptide, means multiple polypeptides collect and they make a circle out of which some ions pass. So one gene is responsible for synthesis of one protein. So there are different subunits, so all these subunits are coming from different genes. So we have to paste all these genes because they are physically connected, and if neurotransmitter come, it is functionally connected. So you have to copy name of each subunit, right? Because some drugs are binding to subunit this, subunit binding to junction of that. Okay. So we will wait for 10 minutes. Have you copied? हो गया ओके ठीक है आपका हो गया कितने कॉपी किए आपने ठीक है for at least 410 at least 410 at least 10 yeah
My problem was for the targets.
yeah
I could not find the name for.
so this is voltage gated sodium channel, right? So just scroll down, and there are different subunit to
Yes.
this
Exactly.
ion channel receptor.
Yes.
So you have to right click this and open into a new window.
Okay. Okay. Let's see.
Yeah, just in new tab you just open it. So this is the gene name, right?
Okay. So we just choose the
Just
only
just
one.
copy it and paste it.
Okay. So we just use one subunit.
Yeah, for the trial run you can use one, right?
Okay. I got it now.
Okay. So if you have copied for one or two drugs, that will serve the purpose. We are moving to next step. Idea will be same. So this is the Excel sheet created by me for all the 42 licensed drugs used for treatment of epilepsy. First is phenobarbital. These are the targets of, and there are the functions like it is potentiator or it is inhibitor or it is stimulator, right? So our objective in step 1 and step 2 is to check what is the therapeutic space. So up to now we know what is the therapeutic space of licensed drug, what pharmaceutical companies are mainly hitting on which targets they are hitting on, right? So now we are moving to step 3, that is identification of disease space, like which targets are mainly involved in pathogenesis or onset of epilepsy, right? So for that we are going to another website that is known as Malacard. So in search section I am typing epilepsy. There are multiple websites like DisGeneT. Okay. So now we are going to associated gene sections. So these are the genes linked to epilepsy. Now we have to copy all the genes linked to epilepsy, right? And we have to paste the name of these genes into our Excel sheet like this. So these are the genes associated to epilepsy. I have already created this list.
Targets for the drugs, existing drugs.
Right.
Now,
Ma'am, this is
whatever genes are as per biology are associated with
this is our workflow. In step 1 and 2, we identify all the licensed drug, and then in step 2 we identify all the molecular target of each drugs, and we created a list. So this is the therapeutic space. Pharmaceutical industry is hitting on these targets, and we are searching for novel targets. So in step 3 we will identify the disease space, like which proteins are associated to our disease of interest, right? And we compare which disease space is occupied by therapeutic targets and which space is empty, like from where we can identify novel targets. Like these targets, it is just for collection. Now first we are collecting the data, and then we manually verify each data. We manually check the name of each drug whether it is licensed or not, and then we manually check whether it is a real target or not. So the type of data and its whether it is validated or not, it is very important for final selection, right? So for the demonstration I am just showing from different. नहीं, it is open source. नहीं, just go for DisGeneT and copy the name of some drugs. Malacard's open है Malacard. Replacement is DISGENET, right?
in the formal session we have given you number of sources. So you use any of these.
Simply go to for the demonstration purpose. Simply go to ChatGPT and type give me 200 or 300 genes related to epilepsy, right? So it will give you list. Just copy and paste into your Excel file, and for just for exercise.
Not for your final exercise,
Like
just
just
to complete the things in time.
in DisGeneT type
Decision you
epilepsy,
type disease name, you will get top
like
10 genes.
only yeah, top 10 or 30, not more than that. So these are the genes, right? So listen, we have to create one Excel sheet, and then in first sheet we will paste the name of drug, and then in second sheet we will paste the name of individual molecular target, and in third we will copy the name of disease protein linked to epilepsy, right? So we have 3 sheets now. Now we are moving to step 4. Just copy any gene from ChatGPT.
Yeah, I have already checked that midwife system. Midwife.
हाँ, which one? So let's move to step. Wait, okay. I'm waiting for 5 minutes. Just you have to go for show 100 or entire. 100. Yep. Copy the name of gene as many as you can. Maybe 200, 300, right? Yeah. Just yeah. Copy the entire sheet, right? With the name of entire. We need at least 200 to 300, right? So copy all this. Just copy and paste in Excel sheet, and then delete all these remaining columns. We need for in first sheet. We will list our. Just paste anywhere if you, but it is just paste here in second sheet. Okay. How many 100? Okay, so just paste it. Now you have sheet 1, that is drug targets. Sheet 2 is disease target. You have identified only four targets. We need at least 40, 50, or so. Okay, just focus on demonstration, and you can repeat it with large number of drugs, right? Just copy. First sheet is licensed anti-seizure drug and molecular target of individual drug, right? Step 1 and step 2. Disease target, right? And third will be our novel targets, source for novel targets. So let me know when to start step 4. So
तो आप क्या करो, I think you can check out.
okay, okay,
Let them note it and call.
okay, okay,
तो time fix कर दो.
okay.
5 मिनट 7 मिनट का.
Okay, so idea will remain same. Just increase the number of drugs and targets when you are doing your original study. So for demonstration purpose, for understanding, just follow what I am doing, right? So up to now, we have completed step 1 and 2. The purpose of step 1 and 2 is to identify therapeutic space, right? Purpose of step 3 is to identify disease space. Now we are going to identify novel space, right? Which space is mainly occupied by therapeutic drugs and which space is still pending, right? So we are going to a website known as Veni 2.1, right? So in first list, I am renaming it as drug target.
Sandeep, talk about this. What is Vani so that they
When is basically for comparison, right? It compare which targets are mainly intersecting and which targets are still
will be
open.
removing duplicates or showing duplicates on two lists. So we can come to know that these are already covered, and the rest we can explore, which are not covered.
So now I paste the drug target gene. So these are the drug targets. I am pasting it in this section, and these are the disease targets. Around 601 disease targets related to epilepsy. Now I'm pasting it. Like we have identified in our study, we identified 601 targets that are related to epilepsy, and we identified around 175 molecular targets of all the licensed drug, right? So now we are comparing how much space is still open. So this is the Venn analysis in which 573, like this number, these proteins are involved in epilepsy, but existing drugs still not able to hit these targets. So this is the open space, right? This is the source of our novel target. So we simply copy these targets and paste it in our Excel sheet. Like we can say these are the source of novel target. So up to now we have completed 4 steps. Now we are moving to step 5, that is how to create protein-protein interaction network. So for that, I am going to a website known as String. Now I click multiple proteins and paste my list here.
There's one ambiguity here, which you cannot understand, that he was talking about genes till now. Now he started to proteins. So okay, so all genes will be making proteins. This is presumed. So now those proteins will be effective. They will be effectors. Okay. So now all the genes which are he is saying is now proteins now.
Like by definition, gene means it is a sequence of our genome that is responsible for production of protein through messenger RNA, right? So basically they are expressing and creating some proteins. That proteins express as, maybe they function as an enzyme, they may function as a messenger molecule, or they are working some intracellular signaling pathways, right? So now we are right. We have to paste that dig and submit to the string, right? So now string will create a protein-protein interaction network. So this is the protein-protein interaction network created by string based on our input genes.
See how the network is. You should see the network. How the network is created.
Arvinder, just wait.
देख लें तो बेटे.
Just let me.
सभी को बैठ जाओ.
Like it is showing how these proteins are functionally related and physically related. It is basically showing functional and physical interactions. Like each node is showing the name of protein, and each line is showing physical or physical interaction, right? So this is basically interaction based on experimental evidences.
No, I think what she want to ask is that we have no list of genes. What to do with the list of genes? So unless until that genes which are converted to ultimately proteins, how they are interacting in the body, in the physiological system, and then we can find out what are their functional significance. Now from this network, he will further take it to, it will further analyze that network. That what can be the pathways, what can be the closely connected like
So this is the string website, right? You have to paste all the genes. Now select the background organism as Homo sapiens. And search, right? Gene name or protein name, right?
Gene names are automatically taken as protein names. String is taking that gene symbol as protein.
So this is the Arvinder, just wait.
Bigger landscape.
उसका कोई फिजिकल और फंक्शनल कनेक्शन दूसरे जीन के साथ नहीं है, तो वो आइसोलेटेड है. ये बेसिकली this is just to show functional and physical connections with each other, right? So this is the protein-protein interaction network. Now we have to export this network as TSV file. TSV फोर्थ और फिफ्थ में होगा, राइट? हाँ हाँ हाँ. Just paste, go to Veni, copy the 46 number. These are the 46 number, right? Copy these and paste into string. Yeah. Now select organism. Yeah. Now you have to select here as a Homo sapiens and hit the search button, right? Just scroll down. Not just on right side. On right side. Just scroll down. Select. Right. Now search. Start over. Just what happened? Maybe you are working with small number of proteins. So this approach we are applying for the means multifactorial disease. So we need at least 200 or 300 proteins, right? So the idea will remain same. So when you will perform the actual study, you have to copy all the licensed drug and then paste it into string, right? After string will give you right. और आपका क्या हुआ?
सर वो चेंज कर रहे हैं, बाकी आगे वाले स्टेप्स हमने
वो स्किप कर दिए. तो आप देख लो कि नेटवर्क को डाउनलोड कैसे करना है, ठीक है? जीन पे हो? मुझे लग रहा है कि मैं लास्ट में चला जाऊंगा अभी तक. अच्छा ठीक है, सुनो मेरी बात ध्यान से. आइडिया सेम रहेगा. जो मैं कर रहा हूँ आप वो देख लीजिए अभी, ठीक है? आपने एज अ लिस्ट पेस्ट किया है, वो जो साइड में आपके कोमा और वो लगाया वो रिमूव करना पड़ेगा. ये हाँ, इसमें पेस्ट कर दीजिए आप जीन्स जो भी हैं.
एक्सेल में जो रखा है वो पेस्ट करना है ना सर?
ये देखो, नहीं, ये यहाँ पे आपके सभी कोमास आ रहे हैं. आपको एक क्लीन बिल्कुल जीन का सिंबल डालना है यहाँ पे और कुछ भी नहीं. जैसे हाँ, बिल्कुल. एटलीस्ट हमें एक चाहिए नेटवर्क, काफ़ी नेटवर्क, 2-3 प्रोटीन ही चाहिए हमें. Basically, agar if disease is multifactorial, then we can create a network. Out of that we can select. If we have only 5 targets, then what is the need of creation of network, right? So we need at least 200, 300. So we apply this approach to multifactorial disease, right? So we need 200, 300 disease target and all the licensed drugs. Yes. उसको हम एक्सपोर्ट करेंगे अभी. उसके बाद हम कुछ मॉड्यूल्स डिटेक्ट करेंगे, ठीक है? ऐसे कॉपी नहीं करते हैं इसे हम कॉपी करते हैं यहाँ पे जाके राइट क्लिक एंड कॉपी, राइट? एक नहीं करते हैं इसे, ठीक है? उसके उसमें जाओ, कहाँ पे करना है आपको? स्टार्ट ओवर. यहाँ पे आप जाइए, पेस्ट कीजिए और बैकग्राउंड डिटेक्ट कीजिए. होमो सेपियंस, राइट। उसके बाद थोड़ा नीचे जाके सेलेक्ट कर लीजिए और उसके बाद सर्च। ओके सॉरी, स्ट्रिंग डिड नॉट फाइंड अ प्रोटीन कॉल्ड जीपीटी से, मे भी कुछ ना कुछ इशू हो रहा हो चैट जीपीटी से ना, राइट। हाँ, मे बी चैट जीपीटी से रिलेटेड जो प्रोटीन्स है, सबसे पहले एक डेटाबेस है डिसजीनेट और दूसरे मालागार्ड, ठीक है। उन सभी ने मालागार्ड ओपन कर लिया है, लॉगिन करना होगा उसमें, ठीक है। कॉपी करके उसके बाद जस्ट पेस्ट कर देना और बैकग्राउंड सेलेक्ट कर देना, जैसे मैंने अभी किया, ठीक है, लाइव में। तो उसके बाद आपके पास क्या आ जाएगा, उसके बाद नेटवर्क एक, ठीक है। नेटवर्क आने के बाद आपको एक्सपोर्ट करना है नेटवर्क को एज फाइल, 4th नंबर पे आ जाएगा, वो मैं शो करूँगा। उस फाइल को हम एनालाइज करेंगे साइटोस्केप सॉफ्टवेयर में, ठीक है। देख लेना, अभी छोड़ दो आप, अगर आपके पास डाटा नहीं है तो। हमारे पास टाइम नहीं है, अगर टाइम होता तो मे भी शायद प्लान था कंप्यूटर लैब में डेमोस्ट्रेशन का। तो अभी के लिए जस्ट मैं जो मैं कर रहा हूँ वो देख लेता हूँ, ठीक है। सुनो एक सेकंड, सुनो, जो मैं कर रहा हूँ जस्ट वो स्टेप फॉलो कर लेना, ठीक है। अभी करने लगोगे तो काफ़ी टाइम लग जाएगा, मीन्स 2 घंटे तो कलेक्शन में लगा दोगे ना सभी लोग। तो जो जो मैं देख रहा हूँ वो देख लो आप। और सुनो, आइडिया समझ में आ गया तुम्हें, है ना अरविंदर? मेरे को लगता है कि अगर ये अभी इकट्ठा करने लगे डाटा तो टाइम लगेगा, है ना। तो अभी 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 नेक्स्ट मत करना, जो मैं बोल रहा हूँ जस्ट वो देख लेना, ठीक है। So everyone listen, you know how to export the network from string or not? Let me show you once how to export the network, and then we will analyze this network to detect some disease module, and then we will identify some most influential gene, right? Yeah. So export, you have to submit the list, then you have to create the network, and then you have to export the network as, so this is the TSV file for Cytoscape. You have to simply download and save this network, right? So before analyzing this network, let me explain you some enrichment analysis. If we select this tab and scroll down, here we can see this diagram, right? Here we can see in which tissue our genes are mainly expressing. Like in x-axis we can see occipital lobe, parietal lobe, frontal lobe, cerebral cortex. So our genes are mainly expressing in brain, not liver or somewhere else. So that means we are going on right track. It is known as enrichment analysis, means out of 600 we refined it to 537, and out of 537, 100 genes are mainly expressing in cerebral cortex, 12 genes are expressing in specific lobe, etc. So we say it is enrichment analysis. Here we can get some another information like biological processes, in which biological processes these proteins are mainly working, right? So this is the regulation of neurotransmitter level, means some of these proteins are mainly involved in synthesis of neurotransmitter, and epilepsy or neurological disease is mainly related to some abnormality in synthesis of neurotransmitter, right? Next is behavior, membrane potential, this is about seizures, right? So this is biological processes. Now we can check cellular component, in which cellular component they are expressing, whether they are they are post synaptic, cellular synaptic. Which gene are pre-synaptic? If simply I click here and go to network, like so these red genes are basically pre-synaptic genes. So these processes are known as enrichment analysis, right? So up to now we have exported the network and conducted some enrichment analysis, like where they are expressing, in which biological processes they are involved in which molecular processes they are involved in, right? So now we have to analyze the exported network with the help of software that is known as Cytoscape. So this is the Cytoscape. I just open the Cytoscape and import my network into it. So simply go to file, import network, network from file, right? So this is the protein interaction network. I simply open. So this is source node and target node. So I simply click OK. So this is the protein-protein interaction network imported in cytoscape. Each blue box is showing gene name and lines showing functional and physical interactions, right? So now we have to detect some disease modules, like which group of proteins are working together. For that, I will go to apps and run mcode. So now mcode will analyze network, and here it is. This is the first group of proteins that are working together. Like 22 proteins are functionally or physically related by 217 edges. Like there are 217 connections between 22 genes. So this is the first group of protein related to epilepsy, right? So now we can manually, based on our expert pharmacological opinion, we can select one gene out of it, right? So this is next is second disease module, next third, fourth and fifth. So that is how you can identify some disease modules out of your novel targets, right? So now next step is to identify most influential gene, like which gene is central to first hub, second hub and third hub, right? So for that I have to open app and cytohub. So this is the cytohub जो मैंने अभी किया, जिसमें हमने मॉड्यूल डिटेक्ट किए हैं, ठीक है? तो जो बनाया स्ट्रिंग में बनाया, ठीक है, उसमें काफ़ी सारे कनेक्शंस हैं, मे बी 2000 3000, राइट? मे बी 4 स्टूडेंट्स वहाँ पे ग्रुप बना के बैठे हैं, 5 वहाँ पे बैठे हैं, 10 बना के बैठे हैं, राइट? तो हमें चेक करना है कौन कौन से ग्रुप्स हैं बेसिकली, और सबसे बड़ा ग्रुप कौन सा है, ठीक है? तो एम कोड क्या बताएगा तुम्हें सबसे बड़ा ग्रुप कौन सा है? लाइक ये इस ग्रुप के अंदर 22 मेंबर है और उनकी इतनी आपस में कनेक्शंस है, लाइक फिजिकल इंटरेक्शंस है. दिस इज सेकंड ग्रुप, दिस इज थर्ड ग्रुप, राइट? तो यू कैन पिक मैनुअली, लाइक फर्स्ट ग्रुप के अंदर से आप मैनुअली स्कैन करो एंड बेस्ड ऑन योर सब्जेक्टिव नॉलेज आप उसमें से एक सेलेक्ट कर लो विच वन इज ड्रगेबल एंड नोवल, राइट? उसके बाद सेकंड ग्रुप में से एक कर लो, थर्ड ग्रुप में से एक कर लो, राइट? एक एम फॉर्म के स्टूडेंट से वैलिडेशन करवा सकते हैं हम, बेसिकली मीन्स हम 600 से कितने पे आ गए हैं? 22 से हम एक मैनुअली देख सकते हैं. नेक्स्ट स्टेप में हम देखेंगे कि डिफरेंट जो हमारे डिजीज हब्स हैं उनके अंदर से मोस्ट इन्फ्लुएंशियल मीन सेंट्रल कौन सा है. ये सेंट्रल प्रोटीन इन 5 लोगों से भी कनेक्टेड है, जैसे जैसे सर ने बोला अनिल सर, तो अनिल सर सेंटर में आज, तो वो उनसे भी कनेक्टेड है, उनसे भी कनेक्टेड है, उनसे भी कनेक्टेड है. तो हमें क्या करना है? सेंट्रल डिटेक्ट करना है. तो उसके लिए हम किसके पास जा रहे हैं? साइटो हब. So Abhi, so this is the rank. First rank is MTND2. Like this protein is mainly involved with mitochondrial function. Like mitochondrial function is central to epilepsy. It may contribute to energy production. It may contribute to ion balance across cell membrane. It may contribute to some like abnormality in this may trigger some seizures. So according it is showing the mitochondrial function or MT1 gene is mainly most influential gene across all the genes related to epilepsy, right? So हमने क्या किया, ये MT क्या करना है? Validation करना है. एनिमल मॉडल वैलिडेशन के लिए हमने एक एनिमल मॉडल जो बनाया था लास्ट स्टडी के अंदर. So this is the study you can go through where we identify, where we transform all the data linked to epilepsy into one target, that is mitochondrial complex 1, and then we use specific inhibitor of that in animal model. So these rotenone corneal kindle animals show full blown generalized tonic-clonic seizures that is resistant to mechanistically different anti-seizure drugs. Means if new drug can show some effect in this model, it will be a novel drug. So that is why you can implement this approach to any disease of your choice, but the framework or the layout remain the same, right? So this is all. If you want to ask question, we have 15 minutes. I can explain it, right?
This paper I will be presenting in the demonstration day after tomorrow, symposium 70. Yes, all 4. You can come if you want to. This work, all this work I will be
लास्ट ये वो लास्ट में देखो, राइट साइड में देखो, मैं क्लिक कर रहा हूँ, ये यहाँ पे ये टेबल है, दिख रहे हो? एक्सपोर्ट, जस्ट सिंपली एक्सपोर्ट हो जाएगा यहाँ से ये फॉर पब्लिकेशन पर्पस. What is the name of gene? You just copy the name, the gene symbol from here, and search. जीन नाम, हाँ वो यहाँ से आप कॉपी, यहाँ से डायरेक्टली कॉपी करके आप एक्सेल शीट में लेके जा सकते हो यहाँ से. हाँ, उसको आपने मैनुअली जाके फिर गूगल से मैनुअली नेम आपको निकालना है. हाँ हाँ, वो जो नेम आ गया उसका आपको स्पेसिफिक उसको आपने वैलिडेट करना है एनिमल मॉडल के अंदर, वेदर दे आर मेनली ओवर एक्सप्रेस और अंडर एक्सप्रेस, राइट. देखो अभी हम 600 से फर्स्ट सेकंड पे आ गए. हाँ, टॉप 10 को हमने जस्ट कॉपी करना है, कॉपी करके जस्ट उसको. हाँ हाँ
नहीं, all these things can be automated if you know coding. You have to write a code to set it up. उसके लिए आपको फिर
हाँ,
Python में सीखिए.
इसको आप वो कर लो ना.
हाँ नहीं, ये तो this is the very basic platform which we are talking. There are many advanced things to it.
नहीं नहीं, वो तो मैनुअली करना पड़ेगा वो हमें. जस्ट अब एक डिजीज आ गया तो उसके उसके ऊपर हम जो वैलिडेशन करें एनिमल मॉडल में. इशू ऐसा है कि अगर हमने जीन का नेम डाल के नेटवर्क बना दिया तो कंफ्यूज हो जाएंगे हम वहाँ पे काफ़ी. सबसे पहले हमने जीन के जो इतने बड़े बड़े टारगेट्स हैं ना, वो उनको हमने एक सिंबल दे दिया, उसके बाद हमने आइडेंटिफाई कर लिया, उसको हमने जस्ट अनफोल्ड कर लिया कि ये है. अब वो
नहीं, that is where we are saying. You cannot go by gene name. You can go by gene symbol. There are certain web services, they are serving only gene number. Okay, so you have to use that. What you can do is you can have an Excel sheet, है ना, with gene name and gene number. And then you can write a code. Yeah, then you can write a gene code, code on Python or something like that. You decode the gene number to that.
I take only 1 to 2 minutes.
It will be done automatically once you have the coding. Okay. The code you will say that this is Excel file. Okay. In column 1 we are having gene number. Column 2 we are having gene name. So decode this list with using that file. It will do it.
You can find it directly from the string. You can find it from the David website. You have to simply put the name of genes, and it is basically enrichment analysis. So you simply have to give the genes. It will enrich some pathways. Right. Okay. There are different algorithms that we can use for enrichment analysis. The thing which we are today, we have selected for today's demonstration is algorithm for prioritizing some targets, right? We can implement these algorithm based on our end goal for enrichment analysis as well. So this is all. this is it. You can take over now.
बहुत मुश्किल से ऐसे रिसोर्सेज मिलते हैं जो आपको अपना एक्सपीरियंस आपको देने की कोशिश कर रहे हैं. यू शुड फील लकी आउट.
ये 8-9 साल की लर्निंग है जी.
यस मैं दैट्स व्हाट मैं वही कह रही हूँ कि यस मतलब कि बिकॉज आपको जो लर्निंग में इतना टाइम लगता है एंड सिस्टमेटिकली दे हैव डिजाइन द स्लाइड सो इट बिकम्स लेक्चर्स आर गेटिंग रिकॉर्ड. सो जितना फ़ायदा आप लोग ले सकते हो एंड प्रेजेंटली बोथ आर ऑल आर हियर. सो कम अप विद एनी क्वेरी विदाउट एनी हेजिटेशन. इसमें कुछ नहीं है. इवन वी पीपल आर लर्निंग एट दिस स्टेज. At the age of 45-50, we people are entering into the computational system, so learning is no ending. Yes. No age bar is there, and no any kind of hesitation should never be there. Yes. Be comfortable and talk to sir at any stage. मुझे तो एनालिसिस करने में अभी टाइम लगेगा. मैं खुद एडमिट रखती हूँ. एनालिसिस इज बहुत इम्पोर्टेंट है. सर का एक वही सर ने भी गीगो आप लोग जब कंप्यूटेशन वर्ल्ड में एंटर करोगे ना तो सर ने गीगो प्रिंसिपल बोला है. एनीवन हर्ड अबाउट इट गीगो? देखा? गार्बेज इन गार्बेज. यस इट्स गार्बेज इन गार्बेज आउट. तो डाटा डालना भी उतना इम्पोर्टेंट है और जो डाटा डालोगे कितने मतलब ऑल डिपेंड्स है ना. उसमें से इन्फॉर्मेशन क्या निकालेंगे फिर इन्फॉर्मेशन तुम्हारी इन्फॉर्मेशन जो निकलेगी वो आगे परकुलेट करेगी. So analysis, data entry, what we are adding, one mistake can lead to the further wrong interpretation and wrong analysis. So keep always a ego principle in mind while performing computational studies. Yes.
So with this, I thank you, sir, for such an impressive and highly engaging training session. And this not only guide the participants but also empower their skill and the essential, which is essential for their modern drug discovery principles. With this, before we go for the next session of our live demonstration, I like to invite Dr. Nilima Dhingra, Dr. Banappa, Dr. Sangeeta Pilakvalsa to please come on the podium to felicitate Dr. Sandeep Kumar as we provide the certificate and small token of appreciation for his work. And I also request Dr. Rajesh Goyal and the team to please come on the podium for the group photograph. Please. God to please join for the group photograph.
Come. Very nice Sudeep, doing good work. Keep rising. Huh? I will come back. I will come this way. Aaju. Let them be the guys. Chal. Give them. Dr. Sangeeta? आप दो. So this is for Arvind.
I also asked.
Arvind आगे आगे इधर आना.
Be at the center.
Thank you. Now we last session of the live demonstration, and this session will be.
Let them be comfortable. Telling you around. Whose laptop is this? Stay blessed. join us
for the
for
final session. And it's my privilege to invite Dr. Neelima Dhingra and her team again to the dais, and we look forward to her insight on the live demonstration on the cheminformatics, docking and the ADME prediction. So I hand over the dais to you, ma'am, and I also ask her team to please set the laptop for the demonstration.
So, good afternoon everyone once again, and it's a high time after post lunch. Okay. Office hours already running, like towards 5. So the minds are. So let me come on. So teacher की पहचान मैं हमेशा बोलती हूँ. We teachers are with you guys, with students, and she is Dr. Priyanka. She has submitted her thesis and about to get her degree soon, very soon, and she is Mansi. So look into the beauty of the, like, she is a synthetic medicine chemist, and her area is totally different, co-crystallization. Some of you may be working on that or not. Co-crystallization is a technique to work and enhance the viability of the some already existing molecules with the poor solubility in it. And out of the, like, she has nothing to do with the talking, but she will be giving you the demonstration on talking, right? So this is that, like, irrespective of from which field we are, don't think it that whether we want to do it. Try to get the computation proficiency as far as you can. Try, start working on it, and no doubt whatever the sir has given today, it was a networking pharmacology, like a beyond step further tha. But today I will ask you some basic questions. If I ask you, did anyone have you heard about the smile word? Smile, smile. आप क्यों बोल रहे हो? हाँ, smile. No, it's not that smile. No doubt it's a smile, but smile word. How you people in the morning I show you one thing. In the computers you saw 010101, but ultimately you saw the mosquito on other end, right? So smile is the simple linear representation of the molecule that moves across the clock. Right, this is the simple representation. So from the very basics of the very basic concepts, how to, like, मैंने सुबह बोला था for beginners. For we assume it that you people are beginner. For the beginner, how to use the chem draw, what is the meaning of smiley, and how the smiley can be immediately converted into the structure. Then how you can be predicting their quick properties, that Dr. Priyanka would be covering on that part. So very simple exercises. We will try that you would be doing it at your end. In case we could not perform it because of the lack of the certain net connectivity, we have already ready with the screenshots, and we will try to give you the small and slowly. We have enough time and very good quality time. We can perform the task very simply. But otherwise, anytime you are open for any kind of query, and you can approach us anytime. Okay, ji? Over to you, Dr. Priyanka and Mansi. देख लो chem draw कर सकते हैं. Would you like to have a chem draw, or and anyone having chem draw with you? No, none of you. आप तो है ही हो हमारे पास. Anyone? No? But will that be info रहेगा? दिखाना chem draw इनको useful रहेगा, because they are pharmacologists, people like it. They don't have that much of interest to draw the, like, until unless. अच्छा ADM में भी नहीं होगा. कितना टाइम लगेगा? कितने सिस्टम्स हैं? हाँ?
कॉलेजी वाले को भी मैम नॉर्मल तो कैमरे का पता ही है. हाँ, तो वो उसके आप स्किप कर सकते हैं बता के नॉर्मली कि ये इसमें ये इसलिए यूज होता है.
देख लो. आप मुझे बता दीजिए, if you want the chem draw on your system, then we need 5 to 7 minutes for the installation. If you want that part to be done at our end, then we can start from the next part. But because Autodoc and the ADMA predictions, for all everything you need to have that software. बताओ करा लो फटाफट करा लो 5 मिनट्स लगाओ चलो लगा लो 5 मिनट्स फिर जब इतना कर रहे हैं तो Shagu, by the time they are helping them, you help them. कर लो 5-6 systems ही होंगे, they are working in a group of 5 systems ही है बेटा. एक मेरे पास तो है ही है ChemDraw.
So now, like we have to do docking and ADME study. So we chose two drugs. First is finasteride and second one is terazosin. And both the drugs are for BPH, benign prostatic hyperplasia. So now, how we draw structures of those drugs. So firstly, you have to Google PubMed. Like you have to type finasteride structure PubMed.
I hope screen is visible to you all.
यहाँ से मेरा ऑलरेडी जूम में ही है. यहाँ मेरा तो जूम में ही है.
जूम आउट है. वो ना स्क्रीन भी जब शेयरिंग मोड में होती है तो ड्यूल मोड में जाके वो मेरे को लगता है उसके
क्या करूँ?
सेटिंग विंडो स्पीकर ना विंडो स्पीकर हाँ डुप्लीकेट में करो तब आएगा ये
डुप्लीकेट नहीं है.
दोबारा एक बार कर लो.
एक बार एक्सेल में करो. इसमें नहीं आएगा.
इसमें आएगा ही नहीं.
फिर से क्लिक करो ना फिर डुप्लीकेट पे.
नहीं आ रहा है. नेक्स्ट टाइम.
वहीं से होगा मुझे लगता है.
इसी को ऊपर करते प्रियंका कोई बात नहीं बेटा.
इसको ऊपर नहीं कर सकते. कर सकते हैं.
हाँ ठीक है ऐसे कर लो बस.
So this is the site where we get all the details for the drug structure. As you can see in the screen, there is 2D structure, there is 3D structure. And now when you all come to structures, then there is a point smileys.
Here you can see the smile and the inchel piece. Look at there.
This is the simplest way to draw your structure in Camro. You just copy this smileys. Just copy this smile. Everyone copied. Then go to Camro. Then go to that edit tool. And then copy and then paste special. Everyone got it? Paste special as smiles. Then you can see the structure is on your screen. This is the simplest way to draw your structure on Camro. Otherwise, you can draw manually here that this left side toolbar. There is so many bonds.
By using the smile, you cannot miss the stereochemistry. It would be as perfect. Because stereochemistry in the chemistry and in the biological part, you know that one isomer may be active and another isomer may be negative. So when you are using the smile, so you cannot, like you will be 100% sure the structure will be perfect. But if I am from biology background and you people are using the like simple ChemDraw to draw the structure, you may sometimes skip the stereochemistry step. So to avoid such a type of risk, that's why I prefer to take the smile. Is that okay? Fine. So if you look into that, she have not given that, but sometimes you may draw the alpha dot line, butadiene, beta dot line, but simply putting the smile. Just see the compatibility and see the beauty of the chemochematics. She used one line and you got the three-dimensional structure over there. Right? Okay, beta.
And you can also draw from this left side toolbar. This like I have to show. For example, I have to make a simple benzoic acid. So in this, there is a from last fourth last there is a ring. The last one benzene ring is there. You just click that ring and then paste on this white screen. If you want to draw your chemical structure. Okay. Now in benzoic acid there is a carboxylic acid is there. So from here we have to put a bond, single bond, and from this a text you just add COOH. This is your benzoic acid. Now you can convert this structure into smiles also. Just go to that edit option, then copy as smiles. Okay. So the basically ChemDraw is only used to draw our chemical structure. Then we have to predict its ADME properties for this drug. So there is in your folder there is a ADME tool. Please check your folders. There is a ADME tool, and in that folder there is a ADME online software links. Everyone have ADME online software link? है? Now please copy number 2 points Swiss ADME wala. HTTP this link.
Swiss ADM is an open source service to predict the properties and all, like what you are asking for, ADME to predict. ठीक है? ये सबसे पुराना सोर्स है, सबसे पुराना, और जितना ज़्यादा डेटाबेसेस आते जाएंगे उतनी ही आपका मतलब, अब देखो ये सर ने क्या बोला, प्रेडिक्शंस। प्रेडिक्शन तो हमारे सर ने कहा कि हम पैदा होते तब से प्रेडिक्शन स्टार्ट होती है कि मेरा बच्चा बड़ा होकर क्या बनेगा। सो प्रेडिक्शन तो बहुत टाइम से चलती आ रही है। तो लेकिन प्रेडिक्शन वो किस तरह
अभी
से
तो
करते
करवाना
हैं?
है,
प्रेडिक्शन
मैं
जैसे
एक ही
कि
ड्रग का
मेरे
करवाऊंगी।
पास, अब मैं ये कहूँगी कि ये डाटा है और डाटा के ये अंदर पड़ा हुआ है, इसी के बेसिस के ऊपर इंफॉर्मेशन है, तो जितना ज़्यादा डाटाबेस बड़ा होगा उसमें से प्रेडिक्शन करना उतना एक्यूरेट होगा। स्मॉलर इज द डाटा, आपकी प्रेडिक्शन उतनी एक्यूरेट नहीं होगी। फ्रॉम अ स्मॉल डाटाबेस इफ यू वांट टू प्रेडिक्ट कि व्हाट विल बी द चांसेस, उतना कम है, ठीक है ना। तो जितना ज़्यादा स्ट्रॉन्ग इंफॉर्मेशन होगी इतने में से मेरे हर टाइप की स्ट्रक्चर प्रेजेंट है वहाँ पे, हर टाइप का मॉलिक्यूल प्रेजेंट है, कहीं ना कहीं की कार्बोक्सिलिक ग्रुप लगा, मिथाइल लगा, बेंजीन लगा, कार्बन में सिंगल बॉन्ड है, डबल बॉन्ड है, उन सब की इंफॉर्मेशन को कलेक्ट करके अगर आपने एक नया मॉलिक्यूल बनाया है तो इस नए मॉलिक्यूल की क्या प्रेडिक्शन होगी। सो इफ माय डेटाबेस इज होल्डिंग ऑल दैट टाइप ऑफ इंफॉर्मेशन, ओनली देन आई वुड बी क्लोजर टू द एक्चुअल ड्रग।
Then copy this link and open it in Google. Got it? Then click this Swiss ADME. Now in this Swiss ADME, like you are showing that we have two options. We can draw a structure of our drug and you just simply paste smiles here. Okay? Now we have smile of our finasteride drug. Just paste in this column, enter a list of smiles here in this box. हाँ. And then click run. Once you pasted your smile, then click run.
We can afford the giving the dryer on the opposite. Right?
Now you can see these are the result for ADME prediction.
देखो रिजल्ट किस फॉर्म में आए हैं, दैट इज इम्पोर्टेंट.
Now we get molecular weight of the drug, how many number of heavy atoms in our structure. Now everybody got this? Now these are the ADME parameters which so basically what is ADME? ADME is first is ADME, first A. A is absorption, then D is for distribution, then M is for metabolism and E for excretion. These are basically pharmacokinetic parameters. And as we know what is pharmacokinetic, what the body does to the drug. So basically this tells how our body responds to drug. Firstly, like in absorption, how our body absorb the drug, then how then where the drug has to be distributed, and then metabolism, how our drug metabolized in our, then excretion, how the drug is removed from our body. So these are the parameters like this.
Now, in this, if you can look into like if you remember my slide, there were 40 organs and 400 cell types were there, right? In one study के लिए ही एक प्रोजेक्ट बन जाता है, because we are synthesizing molecule, right? Simply synthesizing is not completing a task of learning of a drug discovery. The body need to get absorbed, right? And this absorption can be a better in what form? In two formulation. Whether and it's need to cross through the log permeability, cell membrane is there. So different type of the cell structures are there. From starting from mouth till it reaches to the target, it need to come across the different type of membranes. And if I want to take the study as a one project, that whether it is able to cross in which form and what type of the doses, अपने आप में that study is one parameter and one project and one case is there, right? So this way, in order to give 40 organs and 40 cell types, one drug के लिए, that's why we say that it take 10 to 12 years. Because sometime I need to put the molecule in a normal person, another time I'm giving to diseased person. One time I'm giving to a small kid, another time I'm giving to adult person and different conditions also. So wide variety of all conditions. So it is giving the information whether this molecule can cross the blood-brain barrier, whether it is good for the CNS disorder or for oral formulation. Another log permeability, depending upon the drug molecular weight. I hope you all are aware of the Lipinski rule of 5, right? I always love to ask Lipinski rule of 5. Anyone can give me the genesis of Lipinski rule of 5? Oh, I always love to hear this story.
Molecular weight will be less than 500 daltons.
Genesis कहाँ से आया? Anyone? It is really very important to know and acknowledge the ethics by the Lipinski. Lipinski was a scientist. He studied that. Let me try to find out. He picked 2,000 drugs from the market. He picked 2,000 drugs from the market. He said, why these drugs have been approved? What other type of the drugs they are not having? What kind of reason? He said, why these type of the drugs are getting approved? Why not another? He
said, okay, let me find out the common features. And then he find the 5 common features in the multiple of 5, and that's where the magic came. He was a scientist, but he found that all the drugs are having molecular weight less than that. All the molecules are having closer number of hydrogens. All the these molecules are having acceptor bond. All they are having log P value of this and the so. So that is the Lipinski rule. And this show the druggability. Druggability means any chemical, if it is having Lipinski rule of 5, that it is closer to become a
drug-like molecule.
that it is closer to become a drug. That is called the Lipinski rule of druggability. Is that okay?
So like now for oral drugs, our absorption should be high. So for this drug, if you see in pharmacokinetic parameters, this GI absorption is high. So this is a good drug for oral dose. And its permeability log P should be between 1 to 6. This is the ideal range for drug to be permeable. So this is also good for this drug 3.42 if you see lipophilicity parameter. So these are the some parameters for the drugs which should be follow for the drug to come like drug like candidate. And there is no violation in Lipinski rule of 5. In Lipinski rule of 5, there should be one violation should be acceptable. Like there are 5 parameters in Lipinski rule of 5. One is molecular weight, and second one is log P, and then third is number of hydrogen atoms in our structure, hydrogen bond donor and hydrogen bond acceptor in our structure. So there is no violation. So this is the good candidate for our disease. बस. So this is the pre-ADME study. You can do for any chemical structure, any drug in this way. Now next, we are covering docking studies. मानसी आ जाओ, मैं आ रहूँगी, आ जाओ, इसी में खोल दो, मैं यहीं खड़ूंगी, कोई ना, तुम टेंशन ना लो.
Yes, ma'am. Yes, ma'am.
Now, here in the docking, I hope if you remember, maybe if since morning we are hearing, like you first listen to me, then Subhash sir was saying, then Dr. Goyal also covered about. Since morning, you people are using 2 terms, that is one is behave, another is target. And behave and target are taking a blockage and deconstruct, and here we are, that docking is a static docking. Very fine. And these days, earlier I remember when we did the PhD, they there was no concept of some computational studies. Then we are coming to the designing part, and now when we started the computational the docking and the ADME studies, now the reviewers are asking for the dynamic studies also. So because dynamic is that docking is the static phenomenon, because here it is a protein and here it is a line. So okay, if you look into this, she is Dr. Kalpani from Sri Lanka. Right. Again, we had very first interaction on the computer and we are meeting for the first time. So computers are playing very big role, not in only that computational pharmacology, friends also, in taking friends also. So I was talking about that, like you, ligand people are having you. Now PDB is that you have to select your target, right? And we discussed about what are the few parameters that you need to look into while selecting a PDB. Now it's not only merely that you have taken the PDB and you will start doing the docking. Now the important is protein preparation. Are you done with that, partner?
Yes, ma'am.
Okay, so now Mansi will take it.
So a very warm good afternoon, everyone. So let's start with the docking part. Have you installed the Autodock on your system? He said no. He said no. Kindly check your folders. There is a folder Autodock. In this there is 3 setup: Autodock suite, second one is MG tool, and third one is Python. 1 of the tools are there. You have to download it. Yeah, it's Autodock suite. Another one is MG tool, and third one is Python. 3 of them you have to download it. Installed it. Anji. Normally setup ही है. हाँ जी, ये तो नहीं चलेगा. Python रहना ना, MG tool और Autodock करवाना. So let's start with the Autodocking. Kindly note down these steps here. Yeah, 3 of the setups are there in the folder. Autodock, Python. Yeah. Yes. Kindly write down all the steps on a notebook. पाइथन फिर भी रहने दो, MG टूल और ऑटोडॉक सूट करना ही करना था इंस्टॉल.
Mansi?
Yes, ma'am.
Try to give the classification, PDB ID, organ species.
Okay, ma'am.
Hana?
Yes, ma'am.
Then resolution.
This is the site of protein data bank, which ma'am already told you that we select the PDB ID on the basis of the organism, which is Homo sapien, and another one is the resolution, releasing date, and we select the PDB ID on the basis of the receptor, the drug which we have chosen in the study. So on the basis of that we have chosen the PDB ID for the docking study.
So basically the docking study is to predict how a small molecule, that is the ligand, bind to the target protein, and it is used to estimate the binding affinity between the ligand and protein. Fine. So can we start? If you're not installed in the software in your system, you can write down the steps. So let's start. So first of all, when you install the Autodoc suite and MG tools, so there is a folder, program file. Fine. Go through it and then find out the MG tool folder. Click on it. Then go through lib, then site packages, then Autodoc tool. In this there is two DAT files are there, AD4 and AD4 parameter. You both the files are copied. And make the folder. I already make the folder on the name IPSCON and paste the DAT files there. These are the DAT files. If you are not getting any step, you can write the steps, and then after that you can do the docking. After the session you can. Okay, I repeat. Okay, first of all you have to install the MG tool, then go through the Windows C file. In this program file x86, go through it. Then there is a folder MG tool. Okay, then click on lib. Yeah, so then click on site packages, then Autodoc tool, and these are the DAT files. Okay, so the next step is in the program file, go through the Scripps Research Institute. Here is a folder Autodoc, then the version 4.2.6. Then you have to copy two files and paste in the new folder. These four files you have to add in this folder. So let's start with the docking part. So you need to download the PDB ID from the protein data bank site. You have to download this in this way, the download file, and then PDB in the PDB format, and place that file into the new folder. Then we will draw the structure of ligand. This is the structure of finasteride. Fine.
Which PDB format?
ये जो है legacy PDB format, legacy PDB format. इसमें change होगा. इसमें change होगा.
You already just copy down the steps. Don't focus on your laptop because I think Autodoc in some laptop Windows and Autodoc I think compatible नहीं है ना. That's why you just focus on demonstration. Just note it down the steps in your notebook. And you have tutorial in YouTube. You can watch.
Not only tutorials, the lecture is also being recorded on the YouTube. So they will be provided with the.
Focus on demonstration.
So then draw the structure in the CamDraw. Fine. Then we will open the CamDraw in 3D structure in Cam 3D to minimize the energy of the ligand. So this is the 3D structure of the ligand.
You prepare the PDB and are we showing that part?
Yes, ma'am. We converted the PDB ligand into the PDB format from there.
Ligand and the protein preparation.
Yes, ma'am. Ma'am, in the Autodoc. Directly.
Preparation means the preparation of the protein and the like ligand is that we need to, if you look into any molecule, right, it is always in the moment of vibration. It can, in a 1 second, 360 cell conformations can exist. We need to find that because everybody wants to get stabilized in that comfortable form. Same is with the chemical. So the more comfortable form is being selected for the docking studies. And same way it is the protein. So dynamic and molecular dynamics and molecular docking में what is the difference? In that statics, ठीक है, docking के अंदर भी आप बहुत सारी dockings करोगे आगे जाके. You might have got a rigid docking, flexible docking, and the dynamic is that because if it's not merely that a molecule is getting fitted into the pocket, and if this fitting is just merely for 1 and 2 nanoseconds, you have measured the score in a 1 and 2 seconds, and if it is coming out of the score, it means that interaction is not stable. That's why if you look into the papers, dynamics, they are asking you to perform it minimum for 100 nanoseconds. That's why reviewers are coming up with that. Please perform that. Open sources can provide you the dynamic studies for 10 nanoseconds. For dynamic, you need a big server. Okay, fine. But reviewers are coming up with the objections. Okay, you have done the statics, you are done with the docking part, but how you are ensuring the docking? Because docking is the one-time interaction. You might get the score, but what about the stability? ऐसा तो नहीं, because protein is always in the flexible mode. Protein is always in the flexible mode. The moment it is changing its conformation, is the molecule has been popped out? If it is so, it means that interaction is not stable. So docking studies need to be supported by the dynamic studies. And open software can provide you the dynamic studies because open means any systems can run it, and that can उसके लिए small servers are required, that will give you the studies for 10 nanoseconds. People are trying to do it for the 10 nanoseconds. But slowly you will get the objection in the future here that I will ask you to do perform minimum on the 100 nanoseconds. कितना होता है? 100 nanoseconds. So these molecules should stable and interact to do that application. Minimum for 100 nanoseconds, 10 nanoseconds to बाहर जा रहे हैं. Okay, so 10, 20, 50 and 100. Right? The paid software and the GROMAX and etc. There are also, the thing is GROMAX is like GROMAX software compatibility is on the Linux line. Now I am not compatible with the Linux line. It means I need to learn all the Linux. Again, barrier language barrier is there. So I will go for the such type of the molecular dynamic software that is compatible with Windows. If I go for the window compatible software language, then I need to pay huge amount of the hefty amount of the time. So that's why you need to find out that, like if I'm using one server, another server, the important aspect is that you need to find out the compatibility. No doubt there are servers, open service, learning के लिए आप कीजिए, and before learning you need to find out the next step. ये ना हो कि एक step कर लो और दूसरे पे अटक जाओ. You need to plan. So you want to do that? Mansi, we need to stop the presentation for 5 minutes.
Okay, ma'am.
Actually, we want to take the students and we all honored by faculty.
Okay.
And then we will come.
Okay, ma'am.
Okay, fine. That's the most exciting part of the meeting. I know this. ठीक है, आज इसका से touch कर. Ready. नहीं, ऊपर चलो. Don't worry, we will come back to all the talking once again. They're not there to just a break.
The felicitation of the participants.
No, I can't take a
As Dr. helped me, I have to take the slide and go early. So
सलोनी की आवाज जाती जा रही है.
now, first I call on the podium Dr. Priyanka Rana and Ms. Mansi Prashar to receive their certificate of appreciation from the dignitaries and also
डॉक्टर हो गया बस. She is Dr. Jasmine from Sri Lanka, right? Combination है, छोटी लग रही है.
so now I will call each. Okay, and so you will just come and receive your certificates from the dignitaries and also get your certificates. I'll call everyone by name.
Thank you.
So the first participants I like to call is Mr. Vilius Mosacha. Please, sir.
So we planned it that it would be really interesting part होता है, exciting part होता है. You always look forward to this picture. And we got the moment that Dr. Jasmine is here.
And next is Dr. Aditya Vikram Sen. And next in line is Ms. Shreya Saxena. Ms. Shreya Saxena. Is she present? So next is Mr. Prab Meher Singh. Next in line is Mr. Kunal Rana.
Kunal.
Next is Dr. Karuna Shri Polia.
लर्निंग के लिए कुछ नहीं चाहिए, सिर्फ एंथुसियाज्म चाहिए. Z चाहिए. And here is one of the biggest example.
Next I'll call Tanvi Sharma.
Country code as well.
Next in line I'll call Dolly Chauhan. Please stay alert. Shagun Sharma. Dr. Jaspreet Kaur.
Go that way and give it to Shagun.
And after Priya, Anjana. After Anjana, there is Sunil Kumar. After Sunil Kumar, Muzammil Qayyum. Muzammil Qayyum Loan. After Muzammil, Harul Bish.
Don't worry, you will get it updated along.
After Harul is Disha.
Who else?
Disha. Disha. Then comes Akshita. Akshita.
A round of applause for Bahadur, Akshita, and Disha.
Rohini, Nisha, Akshita and Maru.
They are volunteers as well as the participants.
They work really hard to organize it. अब अपने स्टूडेंट के साथ
And then I'll call Anisha Sharma.
Anisha is there?
Anisha.
No,
And lastly, I call myself.
Yeah, that's
They are the driving force behind this. We really want this. Thank you. सचिन का है? है सचिन? सचिन है नहीं यहाँ पे। ट्रेन का सचिन रहेगा।
She was in the sessions at IPSCON. I was there.
पंकज? Okay. She is not on rest and yes, need to take it.
Enjoy your stay in your way.
and then minimize the energy of the ligand.
Run is complete, then we have to save the file in the form of PDB ID. So we have to save as in the form of ligand.pdb. Then the next step is to open the Autodoc. Then we have to go through the file, then preferences, set, and go through the new folder which we have created earlier, and we have to copy the address and then paste in the startup directory. Then click on the make default and set. So the first step is the Autodoc, that is the protein preparation. So go through the file, read molecule, and then you have to select the protein PDB ID and then open. And we have to remove the water molecule which is present in the protein. So go through the edit, delete molecule. The next step is to go through again edit and add the hydrogen. We have to add it the polar only. Then again we have to go through the edit, add the charge, add colon charges.
protein residue, not with the water. Water is having
Unwanted
Residue
residues.
bondings are the favorable interactions, and presence of water will interfere. It will give a negative, false negative charge. Okay. And sometimes when we download the structure, some of the hydrogens are missing. In order to complete the valence structure, that's why we need to add the. So, and all these steps are collectively called as the protein prep. Okay. So we need to understand what we are doing, why we are doing it, and what is the rationale behind it. Performance is okay. Anyone can do the first steps from the there are a number of tutorials are live over there. Every software is there. But important is to understand how to do. And sometimes PDB, like some of the you might have working with different target structures. Some of the targets are they really work in presence of some metals, sometimes it works in terms of cofactors, anything. And if you are working, another thing is important is that, okay, she is explaining the different steps, right? Important is that if you are taking the protein, you people are pharmacology and you can make me understand in a better way. There are two forms of the protein. One is a physiological form and another is pathological. Is there? Yes or no? PDB, right. Protein, there are certain conditions. Now protein is present in my body, presently your body is carrying a matter and they are required for the normal physiological function. So that form is called the physiological. But in the disease conditions, that PDB would be behaving, that structure would be different. So while downloading the PDB, you need to ensure you are downloading the physiological form or you are downloading the pathological. Is that? Pathological form is conformation will be different. It will give you the different interaction what it is present in the physiological form. So please do take care physiological and the. Is that okay? Fine.
Then we add the AD4
So presence
types.
presence of cofactor and any additional ligand, it will change its conformation. So earlier I was doing the studies as a innate address, but I got to know literature said that my protein cannot work without cofactor. And if I did the studies all without cofactor, my studies are of no use. So what is important, what atmosphere you have to create, what are the surrounding factors, external ligand, etc. Literature is very important. If you will say if you are totally leaving it to the computer system, no. Human interventions, human intelligence are always required. Here the important role is being played by human. Okay?
So then the next step is to assign the AD4 type atoms. And then we have to save the file in the form of PDBQT of the protein. We have to select the PDB records till END. Then we have to add and then click on the OK. This is the protein preparation. So next one is the ligand preparation. So we have to choose the open the ligand from the file. Then click on the ligand, torsion tree, choose the root, then detect the root, then save as the PDBQT format. The next step is to generate the grid. We click on the grid, then macromolecules, then choose the protein and then select the molecule. And then save and replace the previous PVDQT file with the new one. So another one step is to again click on the grid button and then click on the set map type and choose the ligand. the two files are generated, that is the DPF and GPF files. These are the files. Then we run the auto grid, choose the auto grid, open it, and then GPF file which we have generated it, and then launch. Yes, ma'am.
Depending upon the structure or the weight of the protein, it takes time. The heavier the structure is, more time it will take. And further system configuration. If you are having heavy machine, it will take few minutes. और ज़्यादा ऐड हो जाएगा अगर आपका normal है. So configuration, pixels, material studio, everything counts. CDMP has some limitation for character files regarding how when I am trying to give a scenario that structure is equivalent, it's not accepting more than 200. Okay. So that's what I was. Yes, yes. Now there are softwares like again free software hai. If it is allowed, if you look into the list of the tools, right, it is giving you like what it can help you. And parallelly one column is there, what is the limit, right, because wide variety of, so some softwares can handle the molecules up to certain limit. Okay, beyond that, like Autodoc is that, or the molecule studio. So they can handle the molecules up to 500 molecules, 10th molecule weight. Beyond that, I need to go for the search. So software to software, their parameters, their features, their description, their power varies. Some cannot handle the metals. Till date, no any software is perfect in handling the metal complexity. Like I am handling with the, I am radio labeling my compound, right? And but in case I want to radio label compound, how it is going to the body, how it is getting absorbed in, I want to study for that. Till I know any system. Yes, this ADME is giving the feature. There may be another software that will give you that. From that you can go. So that now I hope you got the value that what is the free software and what is the power of the paid software. If they are providing you at least accessibility, providing so that's it. Is still valid?
Yes, ma'am.
50% test process हो रहा है. आपके पास इसकी फाइल है, स्क्रीनशॉट?
Yes, ma'am.
वो दिखा दो.
Okay, ma'am.
Waiting for the time. आप इसका वो दिखा दो क्योंकि आप.
This is the last step of the docking, and in this we receive the DLG file. In this we it's showing the lowest binding energy, that is the minus 6.28. Lowest is the binding energy, which means the more is the chances to interact the ligand and protein. This is the D score of the docking. So if I am talking about the 2D and 3D structure, so there is a software that is the BioVia Discovery Studio. In this we will see the 2D and 3D structure of the molecule.
alpha helix है, loops है ना, sometime, and I hope you know the meaning of the homology modeling. There are out of, let us say 30,000 gene structures are being involved in the human person, and only 3,000 have been depicted in the structure. So it means 27,000 structures are yet to be determined, and for that determination we use another tool that is called the homology model. And in that case we need to design the, important is that we should have the sequence at least. How the sequence is getting molded into it, that is homology modeling is going to tell us, right? So जितना ज़्यादा prediction, जैसे जो भी model हम develop करेंगे वहाँ पे, so the closer is the next 60% if it is showing to the value, then it is found as a good model. So if it is showing the lesser similarity, then it is not valid. So number of the tools are rising. Site map analysis is the tool in order to find out the site, active site. Homology modeling is the tool to develop the models of the protein structure that are not still available in the PDB site. So these are you just don't worry about it. In the morning we said only two things are required. One is computer and another is liquid. The rest system is there. Number of the key sources are there. Only thing is you just take to the data first. That's it. Okay?
So this is the 2D and 3D structure interaction of the molecule. Thank you.
Now when we are doing the docking, she has given, if you look into the software to software, the prediction and the representation of the molecules will vary. Some are using the balls type, and they are having written in the green color, pink color. I hope you understand the meaning of all these different colors. Some are indicating aromatic hydrogen, some are indicating pi type interactions. And if you look into the preference, we all know that hydrogen bindings are always being preferred over any another type of the. We cannot say it like 100% you can take, but at least always first step is important to take the rest on the stairs to reach to the next one. Okay? So you people have taken the very first step and wish you all the best. Thank you so much.
Thank Dr. Nilima for sitting since 9 o'clock here at the
She is sitting since the after, right?
and taking care of the entire session. Thank you.
मैं दिखाया था सुबह एक्नॉलेज किया था He is very sweet boy.
इसकी फोटो क्लिक कर मैं कर रही हूँ मैम बिना बोली करनी पड़ेगी.
And also let me क्या कहते हैं acknowledge the efforts of definitely Salome. She is not here. Then who else? Oh.
एक मिनट.
हाँ इसका ना. Okay. चलो. Large. ठीक है. And special thanks to Priyanka and Mansi who handled the workshop. And especially Mansi's, it's her birthday and she was having great party plans, but I made her to sit here and give demonstration to you. Thank you, Mansi. Happy birthday. Happy birthday. Happy birthday. Sure. Okay.
Thank you, ma'am.
What this?
Thank you so much.
Okay, beta. Chalo, let's. Saloni.
क्लोज हो गया
थैंक यू
थैंक यू पार्टिसिपेंट्स
So I thank all the participants for their patience and their engagement in the
पेशेंस उससे भी ज्यादा आपकी जो आपने बैठे हो आपने सुना सब
नहीं really participants they are sitting for the entire session that is commendable कि हमारे हॉल में बच्चे गायब हो रहे बैठा बिठा के उनको पकड़ पकड़ के लाना पड़ रहा था तो यहाँ पर strength is good enough I must say.
So the credit goes to the speakers.
Right. Very good.
Just don't worry, अब लाइटिंग अब तो करना पड़ेगा ना आपको. हमारी सारी टीम ही ऐसी है कि फिर तक से लाइव चले.
याद रहेगा